Okay, and we are live, Sue.
All right, thanks, Gabby. Good morning, everyone. Welcome to this March 27th, 2024 meeting of the Oregon Early Learning Council. Gabby, will you please call the roll?
Yes, Katie Brooks.
I'm here.
Peter Buckley.
Here.
Barry Ford. I saw Barry. I'll come back. And Elizabeth Barr Campbell.
Here.
Okay.
Sorry.
I'm here too.
Great. Robin Hill Dunbar.
Here.
Dr. Peg Miller.
Here.
Subin O will be joining us in just a little bit. Ruby Ramirez.
Here.
And Marie Simons.
I'm here.
Great. And there's Subin right now. So everybody's here, Sue. You have a full quorum. Oh, so you're muted.
Sorry, thanks. Our agency directors will be joining us a little later in the meeting, so we will welcome them there. Before we move into our agenda, I want to acknowledge an article that has come out this week raising concerns about DELC. And I just want to make a statement for the council. We are committed to working with Director Chatterjee and her team to address any and all concerns and to make sure that we do everything we can to have an early childhood system that meets the needs of children and families as well as any agency can. From my experience in working with Director Chatterjee, I'm confident that this is where she and her team are headed. And it's this commitment to children and families, which is why all of us are here today. So with that, we're going to move into our agenda and start out with a very exciting meeting focused on home visiting, which is one of the council's 4 priorities, as everybody on this call knows very well. I want to welcome our representatives from our 4 key agency partners. They're listed in the agenda. I think we've all met them many times, so I'm not going to take time to go through introductions, but I want to thank Kate, Gwen, Mary, and Lois for being with us today. What we know as a council is that our charge from the legislature is to develop an early childhood system. And we also know that a part of that, an essential piece of that, is having an effective home visiting system as well. So we can set the direction as a council, which we've done through our strategic plan, Raise Up Oregon, but we know that to actually implement that direction and get us to that North Star, it takes our partners doing the work on the ground. And that is who is now going to give us an overview of what their agencies are doing in home visiting. So we'll start with our longtime partner and supporter, Kate Wilcox from OHA.
Thanks, Sue. Good morning, everyone. Good to be with you. I'm Kate Wilcox. I use she, her pronouns, and I'm with the Oregon Health Authority. And I'm here to kind of kick us off because what I'm going to share, I think you'll see some common themes throughout. We are at a super exciting moment in Oregon. What we're embarking on, the coordination of the home visiting system, will be transformational for Oregon's families. We all want Oregon families to be connected to the type of home visiting services they want, when they want and need them. And they know, and we know, this is a critical part of the array of supports for all families with young children. However, our current system is so complex that coordination has been challenging at best. And these complexities are include, but are not limited to, different funding sources, state general fund, foundation funding, Medicaid, local contributions, federal grants, as some examples. Different model requirements. Some are evidence-based, some are eligibility-based. They have different durations. They have different entry points. Different statutory requirements govern some of the models. Different types of workforces. We have trained home visitors, nurses, social works, early child care providers, to name a few. Different agencies and organizational priorities play into the complexity. And we have different levels of advocacy and champions for the various programs. So I've been engaged in this work for around 16 years and participated in several attempts, I won't say many, but several attempts to coordinate all these complexities. We've had some pockets of success, but not a statewide transformation that would best support Oregon families. Sometimes people think that the answers do not lie with the coordination of the system, but elsewhere. But here are some questions that I get that head kind of in this direction, and I get these questions pretty frequently. First, why do we have so many home visiting programs? Isn't this too many? Do we really need this many? And no, it is not too many. This, in fact, is an asset. It's our superpower, if you will. We have more need than the collective capacity across all the programs. And a rich system has something for everyone. We know that families' needs are unique to that family. It's not a one-size-fits-all kind of situation. And each model offers a little something different, which allows families to get connected to the right services for them at the right time of need. Another question I get is, aren't families getting multiple home visitors coming to their home? And no, we have looked at duplication of services over the years several times. It just isn't happening as one might imagine. And a coordinated system will ensure that this really doesn't happen. And the third question I get asked often is, shouldn't all the home visiting programs be in one agency? Why is it spread across so many agencies? And this is also part of the richness and the strength of Oregon's home visiting, a variety of approaches and perspectives. It increases access through various access points, meeting families where they are. And that means then that everyone has a fork in the pie, if you will, and is invested to work together to support families. The system is not just about state agencies, but community-based home visiting as well. So there's a lot out there that really can be there for families. So I'm really excited about this work, and all families in Oregon deserve and will benefit from this new direction. So let's maximize our superpower. Gwen.
Thanks, Kate.
Thank you, Kate.
Set up here. Good morning, Chair Miller and council members. I'm Gwen Bachtel, she, her pronouns, and I'm a member of DELC. The Department of Early Learning and Care is committed to promoting coordinated and family-centered services that recognize and respect the strengths and needs of all families, children, and early learning system professionals. Our vision is for families with 0 to 5-year-olds, the professionals to interact with them, and the communities they live within to be supported and empowered to thrive as defined by them. DELC funds a variety of home visiting programs, but we also invest in the early learning system, for example, early learning hubs and childcare resource and referral agencies to support coordination and referrals of families to access resources in their community, including home visiting services. But here's why I'm really excited and about the new Home Visiting Coordination Center and why it's essential to our growth. Typically, state agencies are staffed to support the implementation and administration of funded programs within their agency, with little to no resources to support the coordination of services across state agencies. Over time, this has led to siloing of home visiting programs in and across state agencies, which can translate into siloing at the local communities. But despite the state's challenges with coordination, communities have been innovating, building relationships, listening and responding to family preferences, and promoting access and utilization. Number 2 is in regards to workforce and family voice. By elevating family voice and workforce, this is a big priority of the Coordination Center and our work together as agencies. The center can analyze what we've already heard so that it can be used in the creation of cross-agency action plans and ensure that future engagement with families use authentic approaches to elevate and incorporate family voice in program design, policy, and implementation. And the third area that I'm really excited about is professional learning. This is another priority to support home visiting professionals in a way that values and honors the unique set of competencies necessary to provide services to families. There's an opportunity to align professional learning across programs and offer shared learning experiences. So to wrap it up, this is an opportunity for us to learn about the landscape of home visiting, the home visiting system, and to promote and hopefully fund strategies that are transformational for families, communities, and home visiting professionals. Thanks.
Thank you, Gwen. And Mary.
Hi, good morning. I'm Mary Geelan. I am the Family First and Integrated Policy Manager with the Oregon Department of Human Services. And we at ODHS, our work is focused on promoting the well-being of Oregonians across the lifespan. from universal prevention programs to intensive interventions. And across all of our programs within ODHS, we're working towards serving people more effectively at earlier points to prevent more intrusive and potentially harmful interventions. Thanks to the Federal Family First Prevention Services Act, the ODHS now has the opportunity to expand our investments in evidence-based home visiting services using federal Title IV funds that used to only be available to pay for services to children in foster care, but now can be used for evidence-based prevention services. And over the last couple of years, as we've been planning for how to make the best use of these new federal funding opportunities, without a more coordinated home visiting system, it's been challenging for our department to understand what programs already exist across agencies, how they're currently funded, where there are opportunities for partnership and alignment. For instance, we have been partnering with tribes in Oregon to identify which prevention programs they would like to use the federal 4E funds to support. And they identified Family Spirit, an evidence-based home visiting program developed for and with Indigenous communities. It was only after we rolled out the training in partnership with the tribes that we learned that there were other agencies already invested in Family Spirit. Within ODHS, we're really interested in having a more coordinated system that will allow us to have more strategic discussions about alignment and the possibility of layering of funding streams to maximize the federal, state, and philanthropic funds that are available to support these much needed efforts and to better support the community-based organizations and tribes that administer them. And with that, I will hand it to Lois.
Thanks, Mary, and welcome, Lois.
Thank you. My name is Lois Pribble. I use she, her pronouns, and I am an early intervention, early childhood special education program specialist with the Oregon Department of Education. At ODE, our early intervention programs focus on supporting infants and toddlers with developmental delays and disabilities, and home visiting is a primary service model we use to provide those services. So the key points I want to highlight really emphasize and build on many of the points already made. I believe that the new Home Visiting Coordination Center can really support all of our work in a variety of ways, including supporting the diversity of home visiting programs, fostering high quality professional development opportunities, and centering family and community voices. So as you know, Oregon currently offers a wide range of home visiting programs that support families based on different criteria and needs. Programs implement an array of home visiting models that are based on the populations they serve and the types of services that they provide. This variety creates an opportunity to reach families with different needs and circumstances all across Oregon. Additionally, it promotes the ability for families to have choices in the type of home visiting that they receive. The Oregon Home Visiting Coordination Center will support better collaboration and coordination between Oregon's various home visiting programs, which will ensure that we're all knowledgeable about one another's programs and can support families in accessing the program that best fits their needs and desires. Additionally, the home visiting workforce needs ongoing access to high quality professional development to ensure they are well prepared to support the families they serve. And the Coordination Center can help facilitate collaborative professional development opportunities across home visiting programs. High quality professional development catered to the needs of both families and practitioners can support workforce longevity, as well as improved outcomes for children and families. Additionally, shared knowledge and understanding among the home visiting workforce fosters ongoing collaboration at both the state and local levels. And finally, and most urgently, it's important to ensure that families are centered at every level of the home visiting system. It's important that the home visiting system includes and supports the many diverse families throughout Oregon, including those served through tribal programs and culturally specific programs. The Coordination Center can help identify families who are currently missing within the different structures of the home visiting system and ensure that they are included at all levels of decision making.
All right, thank you, Lois. Wow, I would say we just heard about a dozen reasons why we need a coordination center. So thank you all for setting up the next part of this conversation. And you know, as you look at our council packets and read all of those programs that these 4 agencies administer, I counted up to 13. So maybe there are more. And we know there are more at the regional level that may not just be funded and directed at the state level. So to say this is a complex series of programs is probably a great understatement. So Council, now we're going to hear from the director of the Home Visiting System Coordination Center, Beth Green, who's a longtime partner and friend of this work. And then we will open it up for comments and questions from everybody. So thank you, agency reps, and we will go to Beth Green. Welcome, Beth.
Thank you, Sue. It's a pleasure to be here as always. And Gabby, I think, let's see, share my screen. I have some slides for our conversation today. Whoops, let's get this. Okay. All right, and can everyone see the slides? Great. All right, as I said, it's a great pleasure to be here. I am just thrilled to be a part of this larger home visiting system initiative and to have an opportunity to share with you some of the work that we have been starting to do at the newly launched Oregon Home Visiting System Coordinating Center, which, by the way, is going to have a new name. We realize it's too much of a alphabet soup. So we're in a renaming process to get something that's a little bit easier to wrap your mouth around. So just a little bit of background. I think the state agency folks who started us off today, really, they couldn't have done a better job in laying out why this coordination work is so important and some of the key things that we're going to be doing. And we are really thrilled that through across public-private investments, we have now official funding for the launch of our center to really be that sort of program neutral backbone. That was one of the things that was identified as a key part of having a system building partner, is to have someone who could bring and really work without having a program stake in the game, so to speak. So we are getting ready to start our work. I wanted to share our charge with you, which is directly aligned with the Raise Up Oregon strategic plan goals around creating work that can create an equitable, accessible, inclusive, anti-racist, family-centered system, all the words, for home visiting in particular. And our charge from the Home Visiting Committee was really to work to strengthen those state partnerships that are so important to then allowing local regions to do their good work in implementation of a coordinated system. So our role is really to provide capacity and invest in folks who can keep the momentum going. Kate spoke to some of the efforts in the past that have had pockets of success, but for various reasons, we all know that building and working on collaborative work really requires resources and can't be done on the backs of program and agency partners who already have full-time jobs. So we're really excited to have, and I'm going to introduce you to our team today, 2 full-time systems transformation coordination staff, as well as a small but mighty evaluation team, as well as funding for creating opportunities to bring people together, to build relationships, and to really share information and get to know each other so that they can do the hard work of moving towards innovative systems change. So the next slide has my team. A couple of them are here today. I'm really thrilled to introduce to you Rebecca Brown and Kristen Miyamoto, who are about 1 month in the job. So they're learning and jumping in and running. So it's great to have them on board. And Rebecca will be working as our state system transformation manager, really facilitating state level work to coordinate policy and then be a liaison to the regional work that's happening. And Kristen will be our regional home visiting systems transformation coordinator, really working to identify where those pockets of opportunity and success are happening at the regional level and figure out how to expand and replicate and build on those. And then our evaluation team, Callie and Ron, who are longtime colleagues of mine and have actually been working for the past 9 years with some Ford family funded home visiting systems coordination projects, which I know some of you have heard Robin and others talk about before, and I think we're going to hear about later today. These are projects that where Ford family invested a full-time coordinator into now 3 of the Oregon hub regions, and Callie and Ron have been the longtime evaluation and thought partners for that work. So that's our team. We have a big job. I'm going to share a little bit about our approach to the work and then try to give you a sense of the things we're hoping to accomplish this year. So first, just about our approach, because I really believe that how we do the work is so important to being able to build the collective capacity for systems change. So a couple of our anchors are to learn from experience, both our own experiences, having been around. I've been working in home visiting in Oregon for 25 years and have been part of many of these efforts and conversations about the need for more coordinated home visiting systems. We want to learn from our own experience, but we also want to really create opportunities to hear from others who are out there doing the work, and the families that are the recipients of these programs and that really know best what works for them. So our second anchor is to support and expand the collaborative relationships that we know are really at the heart of systems change work. And one of the things that we know is important, and some of the state leaders spoke to this as well, is that our state system, our home visiting system now, especially at the state level, but also regionally, has not really equitably included a lot of our culturally specific and tribal partners. So one of our goals is to expand those collaborative relationships so that we have more folks at the table coordinating and working on home visiting. The third pillar, which you also heard about from the state agency partners, is to engage family leadership. We know that's missing for home visiting right now, and we know we've heard a lot from parents, but we really want to move from beyond hearing from parents to really creating some systems where they can be part of the decision-making process, both about the vision, what needs to happen, but also about how we get there, because it's big work, right? There's a lot of things that need to happen. We also, just speaking to our learning approach, we want to really be paying attention to things that are working now and learning from those, and then really trying to change what's not working. I mean, part of the reason that I'm here and that we're all here today, I think, is that folks have been acknowledging that things are not working super well, that their home visiting programs are across all these. We have all that complexity, which also gives us richness, but we could do a better job for families if we were more coordinated. And then finally, we'll be hopefully providing that capacity to support transformation, to work with state agency partners and local partners who can really make the changes to support and create momentum. All right, so my next slide is a framework that I wanted to share with you, and some of you have seen this already, maybe multiple times, because we've been talking about this a lot. It's called the 3 Horizons for Systems Transformation, and it's a framework for thinking about systems change that actually comes from the private sector, and that we think is really a good way to think about how systems change should happen. So I want to just talk you through the model, and then I'll show you a version of one that we're looking at for home visiting systems work. And I'll also note that this is a 3 Horizons model. We're going to move to 4 Horizons, and I'll tell you why in a minute. So just to point out, just to talk you through the model, Horizon 1 is in the pink. It's the business as usual. We know that it's not working. It's not fit for purpose. We know there's things that need to change. The question is, how do we get there, and how do we create opportunities for learning and implementing from Horizon 2, which is this blue innovation. Horizon 2 are really those new ideas, new ways of doing business that we know are happening out there and we really want to learn from. And we want to make sure that those then have a forum so they can become standard practice rather than being seen as innovations or local changes. And then, of course, the green is the viable future. That's our Horizon 3. That's our vision for what we want the system to look like. And we have some ideas about that, but we know that there's folks who haven't really had a voice in creating that vision right now. So that's part of our work as well. So this is our initial draft, not at all complete, version of a 4 horizons of change for home visiting systems. And one thing I do want to point out is we are including this 4th horizon, which is on the left here, which is the historic system. And this is an idea that we actually borrowed from our friends in the Portland metro region who were working on a metro area vision for transformation for kindergarten readiness. And they said, you know, it's good that we are in the current horizon, but we really need to acknowledge the historical things that came before, especially when we're talking about looking at root causes related to systemic racism, structural inequities, and that we know that those are going to continue to show up in our current system. So we want to be aware of that. We want to have that in our minds always as we're working to change. And then you can see some of the, at the bottom, we started to map out some of those specific issues in Horizon 1 that we know we need to change. I think our state partners at the beginning set that stage very well. Then we want to look to what are Horizon 2s? Where are those innovations? And that's where we see a lot of our center's work is to identify those opportunities for innovation, what's happening, and really learn from them and bring those learnings to state partners as well as share them more broadly across the regional partners. And then of course, Horizon 3, that's our long-term goal, right? Where we know where we want families to have those right services when they want them, what kinds of services they want for their needs. And we know we want to have an anti-racist system where workforce is strong and supported. So that's the nutshell, right? And that's big long-term work. But I think the important thing about this model, one of the reasons I like it, is that it identifies a way to see all of these things happening at once, right? You don't stop Horizon 1 and pick up Horizon 2. They overlap, right? They're both happening at the same time. So that's one of the things that I really like about this framework. This next slide I shared in December, so I'm not going to spend a huge amount of time on this. But these are the 4, so in the center in the blue are our 4 priority areas for work. And those were part of the recommendations that came to us from the Home Visiting System Committee, which were approved by the council in December. And you can see how those show up in some of the ways that we're approaching the work. But so 4 areas. One is to create opportunities and systems and facilitate that collaborative vision, shared culture. The second is to expand and strengthen that governance boards to really make sure we have family leadership and culturally specific programs. The next is to align and ensure adequate funding. We need funding for the system, but also making sure that we have that rich array of programs that are well supported and well financed. And then finally, collecting and using data. Data systems alignment has been a long time dream of mine, and I know Kate and I have talked about it many times, and it will take us a while to get there, but it's really important, and we hear over and over from the field how important it is for them to get some systems alignment with data requirements. Okay, I'm going to move quickly to the next couple of slides. First, share some progress that we've made already, even though we really just officially launched in February. We've been working to streamline and coordinate and expand our advisory structures. And we did a preliminary restructure for that, which is still a work in progress. We relaunched our steering team, which provides direct oversight to us, so that we're including culturally specific program leaders on that group, as well as other partners. And then we've also expanded the Home Visiting Systems Committee to include some key advocacy as well as CCO partners in that group. We still have work to do. That we need to have more voices at the table, but we've made some progress. This slide, and I'm not sure how well you can see this, but you do have this in your packet, is our initial sort of visual of our advisory structure. You can see our center is down in the lower right-hand corner. And one of our jobs is to facilitate and make sure there's coordination up and down the systems, right? So from us to the steering team, to the committee, to the council, to you all. but also to bring in this orange circle on the left. So this is the Home Visiting System Collaborative, which is a group of home visiting program model leads, primarily at the state level, that have actually been meeting for a couple of years to try to build some momentum around coordinated workforce and other shared areas of program need. One of the things that they have pointed out and that we need to acknowledge and have as a key goal are that these culturally specific home visiting programs here in the gray are not part of that network. It's been the traditional evidence-based program leads, and we know that as great as evidence-based programs are, some families need other programs that haven't come through that system of sort of scientific blessing. And we know that they're very effective. And we know that culturally specific programs are part of that rich fabric. It's really important to families. And then, of course, family leadership, which is floating up there, unconnected right now to anything, because that's really what it looks like right now. There is no system for a system for in family leadership related to that 0 to 3 prenatal to 5 home visiting. So we are going to be working on that as a priority goal for year 1. All right, I know I'm short on time, so I will get through the last couple of slides. These are just some of the real key deliverables that our team's going to be working on. So one of them is around really creating some systems to start to build that cross-system understanding and communication. We've got Google site going that's going to be up and ready to go that'll serve as a forum for multiple programs to share information. We're linking to some of the existing ones that are already in place, like the OHA has a beautiful newsletter that goes out to the workforce. And then we're working on a statewide resource, what we're calling internally a matrix, but the idea here is we need to have something easily accessible and up to date that brings together information about all these different home visiting programs and when families can enroll, how long they serve them, and where they are in the state. And so that's a key priority. We're working on that right now to hopefully have something which will then be a work in progress, because as Sue said, we know about the major state models and we know about some local models, but every time we go out there, we find out about a bunch more programs that exist in the community. And then the second piece is, and I heard someone say this on the state partners, but doing some really focused landscape analysis and what I'm calling opportunity maps to really find out, for example, family leadership. Where is that happening in a meaningful way? Is home visiting and that 0 to 3 conversation happening at those spaces? We know that there's parent advisory councils for the hubs as well as for other state groups. And we want to build on what's there, not necessarily create a new structure, but to make sure that home visiting is at the table where family leadership is happening. And then the other big piece that we've heard about, and the 2 pieces that we're going to be prioritizing in terms of understanding the landscape and creating recommendations for change, or coordinated intake and referral, how that can happen better for families, and data systems and data sharing. And then finally, we will be conducting an evaluation of the home visiting system that'll be led by our evaluation team, and I'll have more to come on that. All right. I'm going to leave you with words from one of my personal heroes, Dolly Parton. I would be better to leave you with her own voice, which is lovely and I find very moving. But I like this quote: if you don't like the road you're walking, start paving another one. And I feel like I've been around, as I said, in the early childhood space in Oregon for so long, and I feel like there is real momentum here to pave this new road and to work together to carve it out of the vast landscape of home visiting. So I am really excited to be here. I think if we have that shared commitment and can keep to that North Star for what we want for children and families, that we can have the hard conversations that it takes to really coordinate across systems and agencies. So that's our goal, that's our vision, and that's, I think, it for me. And I think we're just going to take questions. Is that right, Sue?
Yes, it is, right. Thank you, Beth. Great overview, great work. We're very excited to have it officially launched. And I want to just formally welcome Rebecca and Kristen to our work and certainly to the Coordination Center. We're delighted to have you both on board and look forward to working with you in the months ahead. Yes, Peter.
Thanks, Sue. Beth, great stuff. In the first panel, great stuff too. Really appreciate the information. 2 points, Beth, on the outreach plan. I'm assuming that's going to have specific outreach to our hubs. Our hub does a monthly meeting with home visiting programs in our region. They would love to get this information as soon as possible.
Yep, that is absolutely on our list, is to do outreach to the hubs in various ways through individual interviews so we can talk to the directors and the staff directly, as well as hopefully presenting and getting communications out through the monthly hub directors meetings that happen. So absolutely.
And the second one was when you talk about the coordinated referral and data collection, are you looking into the Unitas Connect Oregon system?
Yeah, I think part of what we want to learn, we know that there's efforts happening around coordinated intake and referral. We have systems that have developed regionally, for example, through some of the investments in coordination that Ford Family has made. And then we know that there are these state level efforts like Unitas and other things, the one through ODHS. So there's stuff going on. So how do we make sure that those coordinated systems, we know where they are and we know who's accessing and working on which? I think that's important.
Thanks.
Yeah, thanks, Peter. Suben, good to see you.
Hi, thanks everyone for the presentation and the information, and hi Beth, it's good to see you. I was thinking about, there were multiple comments about the multiple workforces, right? And I feel like this is a common theme in early childhood education as well, in terms of what's going on with classroom practitioners. And something I guess I'm giving a comment. I feel that it is often understated how important it is for these professionals to see each other and to talk to each other and to develop practices and ideas together. Sometimes it's about congealing and making sure we're kind of coming up with common ideas and vocabularies and things like that. But it's also to have empathy for other people that you're interacting with. And so I'd love to kind of see that as a pronounced part of this, whether it's in Horizon 2 or 3, somewhere in there.
Yeah. Thank you for that comment, Suben. And I agree 100%. I mean, I think relationships are so important and the workforce needs to connect with each other. We've heard that over and over in early childhood pre-K stuff, as well as in home visiting. So looking towards having hopefully some convenings and opportunities to bring folks together. You're going to hear in the next panel, I think, a little bit about a community of practice that Multnomah County has been developing and implementing, and we supported back in the day, that I think has really, it was a way of responding to that need. Like, home visitors want to be brought together so they understand, like, what are the nurses doing and what do we have in common, and really what are we doing together? Ruby. I don't know, am I supposed to call people? Sorry.
Hi, sorry. Oh, go ahead, Marie, since you're on the phone. Go ahead.
Okay, thank you. I'm sorry, I can't see, so I apologize if I jumped in front of someone. Just really want to thank you for the presentation today, everyone who spoke up. One quick question. I know earlier in the previous council meeting in January, we had some conversation and presentation. I think Robin facilitated it around the coordinated care organization metrics, and I just wondered if you could speak to any level of collaboration or collective thinking around both strategies and metrics between coordinated care organizations around the state and the home visiting work you're doing.
Yeah, thanks, Marie. I definitely see those as connected and an important area to learn more about. We have representation now at both the steering and the committee level of folks from the CCO world, which I'm really looking forward to connecting with them and learning more about how that work connects to home visiting and vice versa.
Okay, thank you. Yeah, I just wondered if there was any opportunity to explore any revenue-based models for home visiting with respect to the CCO. So thank you.
Yeah.
So Kate, do you have anything to add to that, being centered in OHA?
OHA is big and Medicaid is the big arm. No, but just really appreciate your comment, Marie. And, you know, as we can, we're connected with Medicaid, certainly some of the nurse home visiting work that we're doing and the university offered home visiting. And we're in constant conversations with the CCO, those in OHA, in the Medicaid division that work on the CCO contracts. And so I think there's opportunity to, as we develop this work, to see how it can connect. I know that especially for those who are Medicaid members, although that's obviously not all the families that we connect with, because we're trying to connect with all families, that getting the CCOs more engaged is really, really critical. And they are to some extent, but it's a little bit more voluntary at this point. And how can we maybe strengthen that so that it really becomes a little bit more elevated as a strategy that impacts their members in a really positive way. So thank you for elevating that.
Yeah, thanks, Kate. Appreciate that. Ruby.
Yes, thank you. Thanks, Kate. I think the conversation about CCOs, that everybody's trying to figure out who all gets engaged in those conversations. So I understand that that's complicated. But jumping on what Subin was saying as well, opportunities for the workforce to kind of get together and see each other and be together and learn things together. I understand that there is someone from the Oregon Parenting Education Collaborative on the steering committee. And I just want to say that I think it would be really lovely to find a way to coordinate, collaborate with that team, because they do have a couple conferences a year. And we do know that there are a relatively big number of home visitors that attend that conference that are also parenting, do parenting work in a different way other than home visiting. But it would be a really great opportunity to sort of leverage the time and the space and give people more opportunities to be in community together. So just throwing that out there.
100% agree, Ruby. And actually, the person who's on, Chelsea Hamilton, who's on the steering team, new to the steering team, she shared that like a majority of the people who attend their OPEC conference, which is annual training events, are home visitors. That's where they go for a lot of their professional development. So definitely a great opportunity to expand who's there and work with them closely.
Yeah, great point, Ruby. And I don't know if any of the agency reps have anything you want to add to the conversation about this professional development and training and cross connections with your workforce. Workforce was the topic the council talked about last month. Spent lots of time with Ben Cannon and his HEC staff trying to understand their role in this. So I don't know if there are other pieces that you want to just make us aware.
I could jump in here, Sue, if you want to. It sort of made me think, I know that a lot of our programs in local communities open up professional learning opportunities outside of their agency. And I'm thinking, I know some Head Starts do that, but sometimes it can be challenging because of the funding streams and not being able to use this funding bucket for non-staff. And so I think, it's definitely something that the steering committee can look into, and how are we promoting and removing some of those barriers maybe to opening up the doors at the local level that come from different funding streams. So I think that there's definitely an opportunity there, but I want to acknowledge that I think it's happening, and it'd be really interesting to know where it's happening and to kind of grow from there.
Great. Thanks, Gwen. Yeah, Kate.
I just wanted to elevate what Subin, what you shared about the various types of workforce connecting and learning about each other and appreciating what each bring to the table, because families need different types of supports, and that's really, really critical. I'm reminded that I think it was 2 years ago, it was during COVID because it was virtual. We had a virtual home visiting summit, and it was really well attended. And while it was put on for McVee because it was virtual, but we invited everybody that could come. And I think opportunities like that, where people can actually come together in person and connect and build that relationship, is something we might want to think about. How do we invest in so that we can help the professionals really understand who else is out there and build those necessary relationships.
Yeah, thanks, Kate. Good points. Other questions or comments as we look at this state perspective before we dive into the community level work?
Oh, sorry. Go ahead, Rob. I didn't raise my hand.
I was just going to say thank you. I just have appreciated everyone's words this morning so much. And it's just, I'm so inspired to think about all the things that we can do together. And so it was just heartfelt thanks. That's all.
I too just wanted to thank everyone, but I sort of have an end state question. So what's the universe or potential universe of families that could be served in the state? And what would it take to reach all folks who would need this service? I guess what I think though, that we get to stage 3, what's what does it look like? What could it look like?
Great question, Mary.
Kate might want to take that with Family Connects Oregon, which is universally offered home visiting, right? Is the idea that all parents of newborns or pregnant people need a support of some sort. So that's one answer, like everybody. I remember I can speak only in a data sense. I know in our McVie needs assessment, I think it was something like 15 to 17% is an estimate of the potentially eligible families across the major state models, I'll say, something like that. Don't quote me on that, but that's my memory. What would it take to serve all those families is a bigger question.
I'll add on to that. Yeah, I mean, the Family Connects model, it's sort of a point in time, we offer it to everybody. And we're working on what that alone, we need to resource it. But I think it's kind of to be determined, because the more we get coordinated, I think the more efficient we can be with resources and whatnot. But we're also going to generate more interest and more desire from more families to participate. And so I think it's one of those that when the team really starts to build out the opportunity map and really get a handle on what's out there and what the potential is, we might be able to quantify that a little bit better.
I can just add to that just for a second. Thanks for the question, Mr. Ford. One of the things that came out of some of our initial work that for the recommendations to the Early Learning Council through the Home Visiting Committee was really kind of this awareness that not all families are aware of the opportunities, even within their communities. And so really focusing some of the work on promotion of all of the opportunities so that it's a high rate of utilization in communities. So I think that was one of the areas that we also recognized, and also that really digging in and better understanding if services are not being, is there a promotion aspect of underutilization, or how do we get full utilization, but also recognizing that we have work to do on diversification of the professionals in the system, and so that it's more accessible to a larger community.
Yeah, thank you, Gwen. Good point. And I know part of what the Coordination Center is going to be looking at is communications, both internally within all of these great programs and your staff, but also how do we communicate with families so that what are their trusted sources of information so that they understand what programs are available for them. Yeah. Peg.
There we go. I want to say thank you to everybody for presenting. It is so exciting, having worked with young families for years, to realize the importance of the coordination of all of this. And I think I echo what Sue and Gwen just said. I think the more we can center family voice and get a more diverse home visiting professional population, the more people will be able to serve. Part of that is developing those trusts, and that really sets the stage for families being able to access or being willing to access their services kind of going forward if we're looking at starting in the newborn period. So thanks.
Thank you, Peg. As a pediatrician, Peg is sort of in the real maelstrom of what families need and how home visiting plays a role in that. Any other comments? You know, I know in Katie's region, which is Central Oregon, the hub plays a key coordination role. So somebody else was talking about, you know, what is the hub's role in all of this? And I think what Brenda and the Central Hub have developed is just one model that we can look at and hubs can look at. And Peter, I know your hub is also very active in that coordination. So we're going to be focused on hubs at our June meeting, so we can sort of fold this into that whole conversation as well. Any other questions or comments?
I will just make one more comment.
Yep.
I see that in the Horizon 3 of a new system, you also talk about workforce. I can't stop talking about workforce, obviously. But I really appreciate the idea of having sort of the map, your opportunity map, and then I would love a conversation around once we map out what's out there and what workforce does what across these programs, it would be wonderful for us to start thinking about what are pathways for folks in the field to become home visitors, across the different programs, whether that's, you know, you do a popular education model or you're a nurse. How do we get folks in this field? So I will just leave that. I'm very excited about all the potential and all the work that has been done in this very short time. So appreciative to all of lots of people on this call that have been doing work on this project. So thank you.
Thanks, Ruby. And you know, another, I think, very encouraging part of this conversation, and Mary Gielen with ODHS talked about it in her comments, which is that we've got, you know, this relatively new federally funded program in Oregon, Family Preservation, and then we've also got Family First. And you know, it's the prevention end of the spectrum that they are focused on. And obviously that's exactly where home visiting sits. So I think the opportunities to work more with Mary and ODHS staff as we figure out, so where do those programs fit into this world and a coordinated system. So Mary, we appreciate all of your involvement. And I think everybody on this call, our guests, are involved in some aspect of this home visiting system initiative, whether they're on the steering committee, the collaborative, our committee, the home visiting system committee, or the council. So it's quite a network already. It's very exciting. So Beth, thank you for saying yes when we asked if PSU would like to be the center for this. And once again, welcome to Rebecca and Kristen. We will look forward to hearing from you at future meetings, I'm sure. And thank you to our state partners. We appreciate what you do, what your teams do, and we're looking forward to hearing from your directors in about an hour.
Thank you, Sue. It's an
See
honor.
what they want to add to the conversation. So thanks, everybody. So we're going to, in 4 minutes, we're going to start our community home visiting system panel. And I see that our presenters are joining us.
Yeah, we're just waiting on Vanessa, Sue, and I can let you know as soon as she gets here.
Oh, okay, thank you. Thank you. And the agenda showed Representative Reynolds joining us now, and in fact, she's going to join us a little bit later, around 10:45, we believe, depending on what her schedule does. But we're excited to have her also updating us on her vision for home visiting, since she plays a critical leadership role in this state. So we'll look forward to seeing her. And I'm going to turn this over to our fearless co-chair of the Council's Home Visiting System Committee, Peg Miller, who's going to facilitate the conversation and sort of lead us into the community panel. So Peg, I will turn it over to you.
Great. Thanks a lot, Sue. And again, thanks again to everybody who presented this morning. It's really, as I said before, really an exciting time, I think, for home visiting. And it's great fun to be able to do our part in moving that forward. We're going to continue the conversation on the home visiting system with our next panel. And this is an interactive panel. It's designed to provide the council members with up-to-date information about some innovative and collaborative community work supporting the development of home visiting systems across Oregon. I'm delighted today to be joined by Vanessa Pingleton, and hopefully I'm saying that right, Vanessa. Vanessa is the Early Learning Program facilitator for Douglas, Klamath, and Lake counties at the Douglas ESD. We're also joined by Elizabeth Carroll, who is the Parent, Child, and Family Health Home Visiting Supervisor at Multnomah County, and Sarah Stevens, the Director of the South Coast Early Learning Hub. These folks are here today to talk about the home visiting system within their region and to give the council information on work happening in their communities. So what will kind of the format we'd like to take is that the speakers have been presented with 3 separate kind of topics to talk about briefly. And we'll let them each individually talk about each one at a time, and then we'll open it up to the council for questions. The first question is, what is your biggest success in the development of a coordinated home visiting system? What are the biggest barriers to your efforts to create a home visiting system? And what are the headlines you'd like to share? And let's start off with Vanessa, please.
And Vanessa's not on yet, Peg. Is it okay if we go to Sarah? I think Sarah.
Sure. Let's go to Sarah.
Good morning. Thanks for having us here and giving me the ability to share. So 18 years ago, regional home visiting partners began gathering in a program manager's basement, recognizing the partnerships are critical in achieving positive outcomes for children and families. The South Coast may lack resources, but it's rich in relationships. 10 years later, thanks to the vision of these partners and funding support from the Ford Family Foundation, we established a full-time regional home visiting coordinator to support consistent regional coordination and collaboration. The success of our coordinated home visiting system has been multifaceted. We've built trusting relationships among home visiting programs, reducing competition and enhancing cross-program communication and integration. It's supported unified external communication plans. We've established a dynamic parent advisory committee to ensure family involvement in decision-making and equitable services. We've launched a regional database for coordinated enrollment and referrals to systematically assist families and partners. And we've strengthened the South Coast Early Learning Hub's capacity to focus on services for our youngest children and their families through cross-sector collaboration. As you know, home visiting is the primary method to prevent entry into foster care. Home visitors carry a high-intensity workload and are in challenging situations, leading to high turnover in this field. Our team leads ongoing professional development initiatives for various programs and partners, resulting in a more supported and robust workforce while also creating pathways for ongoing education, including degree completion. Recently, SPREL applied to become the lead agency for Family Connects. I'm confident that the efforts of our regional home visiting system coordination set the groundwork for our future collaboration with OHA, Bay Area Hospital, and the Family Connects model. In the past 2 years, our team has also supported Building Back Healthy Families Oregon and a new Coastal Families Relief Nursery. Leveraging resources and assistance from the Ford Family Foundation, the Department of Early Learning and Care, and PSU has been critical in securing the necessary funding and capacity to accomplish our tasks. By combining and merging funds, we've accomplished remarkable results. The annual budget that funds our home visiting system coordinator is roughly $145,000, supplemented by additional in-kind contributions from our partners. This journey has taken time. As mentioned earlier, we've been striving to achieve these goals for over 8 years. This work demands patience, trust, and dedication. The state can enhance this work by facilitating coordination, ensuring clear and consistent communication, and fostering collaboration among state departments dedicated to home visiting. For the regional system to operate effectively, state agencies should have shared priorities, aligned data systems, and a unified vision.
Sarah, I appreciate it. Maybe we can go back to Vanessa. Vanessa, we're talking about the first question about what's your greatest successes and barriers. And we appreciate you joining us. Thanks.
Yeah, sorry I got on a little. My invite said 10, so I apologize for being a little bit late. So for the South Central Early Learning Hub and our region, one of our biggest successes, and it's one we talk about often, I'm sure people might have heard of it before, but is our coordinated intake and referral. We call it Community Uplift. And what that is it is through our region, it's our coordinated intake and referral. We built this as a region between Douglas, Klamath, and Lake counties with our advisory work groups that were built of early childhood home visiting programs, ODHS, our county public health, and just a variety of community partners. When we first built that, I think there was probably 36 or 40 people that went into building it. So to date, we've received 1,342 referrals, and we have been able to get in contact with 945 of those referrals. So what that means is our family resource facilitator, which is employed by the South Central Early Learning Hub, they receive a referral. They then contact that family. So out of those 1,342, they've been able to contact 945 of those referrals to get them connected to all kinds of resources they're looking for. So that includes early childhood home visiting, that includes housing, that includes all kinds of different things, right? They do it through our family resource facilitators, really approach families with the motivational interviewing techniques. that they have learned. Building relationships. And I will let you know that we have received duplicate. So we've got families connected and they've got some base help, and then they call us back looking for additional services that we might have mentioned to them, but they weren't ready for it yet. So it's really become in our region, it's been the go-to. And why I know there are other platforms. Community Uplift started before there was Unitas here in or Connect Oregon. And what we have done is we just went in with Unitas or the platform. So we're in that, and we're also in Connect or Healthy Klamath. And then in Douglas County, we have an additional kind of coordinated referral, and we're into that platform too. So really, we take this approach of there's no wrong door. The families can call. The nice thing about Community Uplift is that it was built completely by the community, right, who is providing these services. You get to talk to a person. They get to explain what programs that are available to you. So you get to learn a little bit more about those programs. And then we do a closed loop. So then we contact whoever we received a referral from. So we get back into them and said, hey, we received this referral, let you know we got a hold of this family. And these are some of the services we sent the referral to. And then the other thing about us is that we can, you can self-refer into our program. So any family can see, they can get our brochure. We have many ways to do that. And then in our database, as I said, we've sent out referrals. In our database, we have 73 different organizations throughout our region that are in there. And what that means is that a family says, you know what, I would really like Healthy Families in Klamath County, and I might need a public health nurse too, because my baby just got out of the NICU. We go in, just push a button, and that referral gets sent straight to those agencies with all the information that our family resource facilitator collected from them. So they're not having to tell their story again. Families aren't having to repeat and tell their stories. So that's really one of our biggest accomplishments we're most proud of. We have a lot of others, and I think Sarah and Elizabeth also are going to talk about the relationships that we've built, because that's been a huge success in our region also. Just enormous, the relationships. I come from one of my counties did not play well with each other in the beginning, and we heard that very loud and clear. And now, if you guys look at the materials that we handed out, you can see where we show the greatest growth in our relationships. And I think that was in some of our materials we gave you guys. One of our biggest barriers, I would say originally, was travel, right? We cover a big region here. And so travel made it hard. And, you know, not just the cost of it, but the time it takes to do it. And then reaching out to those outlying areas that really aren't always accepting of other people coming in that aren't from their county. And now I think one of our biggest ones, and I look at this as a whole, not just our region, not just early childhood home visiting, I'm seeing it everywhere, is the retention of employees. We've got people coming in, transitioning in and out, so it makes it really hard to keep the momentum going forward. So we're always trying to build and educate and all of that. It's a big barrier for us. And then making those connections, right? Some people you had a person who was there and they had passion for what we were doing, and a new person comes in and they're like, I don't see where I fit in. I don't see where I fit into this role. And so taking the time to build those relationships and connecting the dots is important. And the other piece of it is our people who we're rural, right? So sometimes those positions don't get filled. And so now you've got an employee taking on multiple different caseloads, right? You've got supervisors who are filling in for home visitors. You've got home visitors whose caseloads are larger. We've had some of our supervisors, they're now becoming the supervisor, janitor, and home visitor, right? So it's just that part is really tough when we come to employees. And then I guess my other piece to talk to you guys is our DEI approach. And I think really one of the biggest things on that is building our capacity and partnerships, including building our parent leadership committee. and to assure family voice leads our work. So we just in our region have just started this work, and it's been pretty darn amazing. You will also see in our material what really kind of provoked us to do this was our family journey mapping. That was a very powerful piece of information that we received in our region. It showed what families were looking for and what they're wanting. And so we're just now starting that. We've sent out surveys through our parenting hub and our home visiting database, asking families like, have you experienced early childhood home visiting? And what are the benefits that you've received from that? What was your experience? And so families are being able to share that with us. We've also had some community input sessions where these were held in person. Families are showing up and really building those connections. And one of our biggest takeaways that we are learning so far is that families are looking for connection. They are wanting parenting support groups. They desire connection. And some are very curious about what does this mean to be a parent leader. And so we've got people coming in and learning that. We also work closely with the Cow Creek Band of Umpqua Tribe of Indians and the Klamath tribes. So they sit at our committees. They're giving us input. They are making sure that their families are getting connected to the services that Community Uplift might be able to offer. And we're hearing their voice. And how can we in our region make home visiting equitable and inclusive? So that's been very important to get that piece of information from them. And then the other part of our work is we really have a diverse group of individuals who come with not only their professional experiences, but their own personal lived experiences where they're able to share and help mold the work we're doing and the way we're going. And I would say really that's what led our region. So when we first started this journey of early childhood home visiting systems coordination work, the Ford family held this great gathering and we all came and we got to hear all these different things. But our region picked where they wanted to go. And our coordinated intake and referral was where they wanted to start our work. And I think that shows of how much we've grown. I know a lot of people call it homegrown, and it truly is. It was truly amazing to see this group of diverse individuals come and give their experience and what they wanted to see when they were either receiving referrals or sending their families, giving their families this to use as a tool to get help or support that they're looking for. And I think that's about it for my section on that.
Thanks a lot, Vanessa. We appreciate it. Elizabeth, can we hear from you about that first question?
Yeah, absolutely. And I think you're just going to hear a lot of echoes of the other two areas. With a little bit of metro thrown in. I went a little long on this piece. I'm going to go short later, but I'm kind of a geek about home visiting systems. I've been working in this area for a while, and so I went a little deep here. So I completely agree. New and enhanced relationships are the foundation of any success that you're going to have with home visiting systems building. Multnomah County looks pretty complex and culturally diverse and functions for the most part informally. It's the relationships that really make things work. So prior to the arrival of MCV funding in 2012, we had no identifiable home visiting service array. And once receiving the MCV grant, our first step was to find the existing early childhood partners to create a service map. And it wasn't easy. Initially, providers were generally unaware of each other. They were engaged in literally no shared activity across organizational boundaries other than competing for funding. A sense of competition for resources really prevailed, and walls were built around their practices and policies, kind of like trade secrets. So it was a super exciting place to start because there was so much to gain and so far to go. And the reason we made headway was that we had MCV funding. It funded my position for about 0.2 FTE. And so critically, the PSU Center for Improvement of Child and Family Services was our partner and our guide in the first few years. And they provided critical infrastructures in key areas like elevating home visiting to leaders and high-level system partners, scheduling and hosting many, many meetings and gatherings, and food, note-taking, debriefing with local staff, creating agendas, and managing communications across our large kind of disjointed county. And I'll also add that at that time, I was starting a master's program at PSU where I was able to center this home visiting systems work in my research papers, my capstone. And I only mention this to make the point that, like many professionals in early childhood, I did not arrive to this work with a resume supportive of the role I was taking on. This is professional level, highly specialized work that cannot be tacked on to existing early childhood workloads. Not in our large metro county or region, and I'm hearing from others, not in theirs either. It's a job unto itself. So I wanted to make that point. Funders are, they were energized by our early activity. We had the McVie and Multnomah County investments, but soon we added grants from our hub, the Portland Children's Levy, Care Oregon, and Health Share. And these, along with literally thousands of hours carved out by local program staff, leaders, and families, led to a very engaged and productive first 5 years for our home visiting systems community. To summarize the successes that we had early on, like the first 3 years, we created a pretty well-oiled, very inclusive home visiting community of practice. The structures we used are in some of the documents that I shared, but the main thing was that everyone had something to sink their teeth into. So we gave the worker bees work plans to do things, and the planners things to plan, the leaders meaningful decisions, and a leadership council. And for most of the community, providing a chance to connect and share with each other was really missing. So providing that really brought us together. And then we also had a family advisory that no longer exists. It was funded by McVie for a limited time. And we haven't, we've been more drawing on the work of other family advisories rather than having one family advisory for home visiting. But it was a lot of work, and we still have over 200 members in just this home visiting workforce. By the 5th year, we had some concrete accomplishments. We had formal community agreements and a shared vision and values that defined our work. We had a significant role writing the statewide home visiting competency standards. We focused on that with our workforce development work group. We have a monthly newsletter sharing training resources and family resources, and a comprehensive standardized inventory of the home visiting service array with relationships to match, and about 10 MOUs for cross-program referrals. We had a shared training plan, and we had several very large trainings happen. But then our biggest barriers came in. Just as our work was peaking about year 5 in 2017, our directives were clear, but also the complexity, our awareness of the complexity of system building really set in. And the community seemed to lean heavily towards maintaining a less formal relationship-driven referral coordination system, as opposed to this kind of like imagined automated data system that would be, insensitive to vulnerable families, with overload programs with demand for slots, for services, and would create a lot of added work in, given our shared value of no wrong door, finding families somewhere else to go once their programs were full. So I think funding those systems roles, those coordinator roles, that was really the barrier, because there just wasn't staffing to manage all of that sort of overwhelming systems possibility. And then from that concern came some great suggestions. The managers in particular insisted that systems work to make things easier, more relational, and not just more work. So a strong suggestion was that government funders should be coordinating their evaluation measures and agreeing to common and stable equity-driven data points. And also shared reporting formats, shared grant and RFP applications, so that these CDOs, many of them small, culturally specific, don't have that whole added work of all of that administrative work just to get money, honestly. And that, so to summarize, the barriers in the last 5 years: complexity with limited staff time to address it, data and reporting for braided and blended funding sources, funding generally, and other systems work, which is all for the better. We have our already network, a Metro Region Early Childhood Systems Focus Group. We have the Early Childhood Coalition. They're doing incredible work, but it has drawn that limited piece of systems energy people have when they're doing the rest of their work. But that's been fantastic. And then, of course, the global pandemic was a big bummer in systems work for a while. So that's the first. Are we just doing the first question right now?
Yeah, thanks.
Okay.
But I'm going to have you start off with the second question about what your DEI approach with respect to the development of your home visiting system, what that really was.
Sure, thank you. So more and more our local Multnomah County and regional approach has been assuring that improved early childhood systems center the needs and voices of those in our community who experience the deepest disparities. So less universal, more targeted. Our working theory is that if the systems we have are responsible for consistently producing racial disparities, they are not the systems we want to enhance and improve necessarily. And this runs a risk of increasing disparities if we were to make those systems work better. So conversely, designing system improvements specifically with and for those experiencing racial disparities, it should be our first thought and our primary goal. For example, the innovations piloted by our local Healthy Birth Initiative program to improve Black maternal health and birth experiences and outcomes has the potential to change and improve our systems in foundational ways that are likely to lift all communities. That's sort of our operating approach. And so another, a local example in our Healthy Families program, acknowledging that many of the families in our birthing population are underrepresented in the evidence base of our nationally accredited model. For example, foreign-born mothers, that's sort of one that pops to mind. We've worked on culturally adapting our HFO model through staffing teams entirely from the communities they serve and supporting their tailoring of service strategies. So locally, the program, it's one of our largest home visiting. It might be the largest home visiting program in our county. And locally, the program's comprised of our central admin here at the health department and 4 community-based organizations. So these include 2 culturally specific and 2 population-specific home visiting teams, an African-American team at Albina Head Start, an immigrant and refugee team at IRCO, and we're currently requesting proposals for a Latino team and a team for families impacted by substance use and mental health challenges. So families with intersectional identities within that would just choose where they would like to be served. And they all have access to culturally specific infant mental health consultation as well. So we're also joined in our metro region, which is how we think of ourselves more and more, by Clackamas and Washington counties. And Washington County, for example, just got a huge grant, $1.23 million per year for 4 years to develop what they're calling the Dooley model. And that was from the Office of the Assistant Secretary of Health and the Office of Minority Health. And they are training an expanded workforce of dually certified community health worker / doulas to really boost our systems change work and impact racial equity in birth outcomes. Another example I really want to share, because it's been so exciting to work with is the Chaku Manaki Flush program, which is, I'm not saying it right, I'm sure, but it's the Chinook Wawa for Help Me Grow. It grew out of our local Help Me Grow program. And this is an early childhood program, multimodal, including home visiting, that was developed through the Future Generations Collaborative, specifically to serve urban Native families. And we're currently seeking McPhee tribal funds to sustain this regional pilot. But the project has a unique systems approach, which I would love to also see expanded more, which is they invite trusted system partners that they've built relationships with into the nurturing space they've created with families in like family groups and play groups to make those service connections as direct and relational as possible, as opposed to like a call center or something like that. So again, that relational piece. So in summary, the clear benefits, I also see in having this metro region DEI approach include, we have services and people that are trusted to retain, the services are trusted and we can retain families when they move. So if you move to Washington County or Clackamas County, you can still be served by the same program. Diversified funding strategies, like Washington County has pursued that awesome opportunity. Sharing the work of finding and applying for grants is a benefit to our region. We've increased stability in culturally specific teams because they're not competing with each other for staffing across the county lines. And resilience as political winds shift. DEI is political, and sometimes county commissions don't want to focus there. But by having the work be regional, the work continues even if a local government body doesn't want it to, I'll just say.
Great, thanks a lot, Elizabeth. Sarah, will you comment on the DEI approach that your group has made?
Yes, happy to. Thank you. Unlike our urban partner, we lack many culturally specific organizations. And so the SCREL does prioritize equity, but we also recognize the geographic diversity of young children on the South Coast. SCREL is dedicated to offering support and resources in all communities throughout our region because we know that this geographic diversity results in varying levels of service accessibility. Since 2019, we've helped coordinate the South Coast Equity Coalition. In 2022, in partnership with United Way of Southwestern Oregon and with support of many other partners, the South Coast Equity Coalition became a regional health equity coalition, a program of OHA's Office of Equity and Inclusion. United Way serves as the fiscal backbone, and SCREL partners with many hours of in-kind technical assistance and support for the Equity Coalition. As a highlight in the DELC's recent Early Literacy Success Initiative submission to the legislature, our team leads the diversity, equity, and inclusion in early care and education professional learning community. This is a cross-sector cohort of professionals coming together for a 7-session series of learning and discussion about incorporating DEI into their classrooms, family support services, and focusing on inclusive practices while celebrating diversity. Introducing children to stories of children and families with diverse perspectives and backgrounds not only promotes early literacy skills, but also promotes inclusion, compassion, and understanding. Participants including early childhood educators, home visitors, parent educators, children's librarians, kindergarten teachers, and others. These participants receive children DEI books and activities for their programs. Additionally, our home visiting system coordinator was recently invited to join the early education committee with the Confederated Tribe of the Coos, Lower Umpqua, and Siuslaw Indians. We see this as a huge step in our relationship building with one of our 3 local tribes. Thank you.
Great, thanks a lot. Vanessa, I know you already commented some about the way DEI has impacted your programs. Do you have anything additional to add?
The only thing I would add in addition to is that the South Central Early Learning Hub were fortunate enough to work with capacity building partnerships organization, and we as a region came up with an equity lens document, and that document is used by all of our partners. And we discuss that at every one of our PAC meeting and our regional governances. How are we using it, this document? How are we ensuring that we're getting all our diverse voices and that we are equitable and inclusive? It's been a great document, and we've heard nothing but positive things about that. It's really helped. We use that in the work that we used it when building our parent surveys. We use this document when we go to do community events, right? That through our region, making sure that we are bringing materials that are appropriately translated, and that any incentives that we're offering are appropriate also. And I think that's
Great.
all I would have to add to that.
Thank you very much. We're running a little bit late, and the panelists have been kind enough to put their written comments about the third question in the packet. So in order to leave time for the council to ask questions, I think we'll defer that third question, but open it up now to council to ask questions of our panelists. Obviously, everybody has made, or these three areas have made great progress.
Hi, this is Marie. I don't know if you can hear me. I
Yeah,
just
go
want
ahead, Marie.
to acknowledge. Okay, thanks. I just want to acknowledge Sarah. I know she presented and talked about the South Coast region, but really the relationship building, which we heard as a theme, really key. She's incredible and pivotal role in that. So appreciation for that and acknowledgement. That's a key for success in region. So thanks for that.
It just strikes me how important with all of your presentations, those relationships are, because we can try to solve this with technology and with new programming and all the things, but just this whole theme of relying on existing networks, becoming more aware of them, and providing a service where people are coming from and the spaces that are comfortable for them, I think it's phenomenal. It's like common sense, but it's not. And it's just really good to hear. So bravo.
Peter?
Yeah, I would echo the bravo too. And one question I'd ask probably of all three is we get questions oftentimes around the longer term outcomes for families. And I'm wondering, do any of you have any kind of program in place that can help the home visiting programs track the long-term outcomes for the families that they serve? Do we know, for instance, if a family has participation in this program, that their child is more likely to enter kindergarten ready to thrive, for instance?
Who wants to take that?
Nobody wants to take that.
Go ahead, Elizabeth.
I'll say, no, we don't. And that's, I mean, at the model level, right, you get research that, is carefully crafted by that model to show long-term outcomes. I'm sometimes dubious. And also there's lots of programming that doesn't have that kind of infrastructure to have long-term research happening. But that is, I didn't get it into my written piece, but I added it in my head afterwards. That is one of the things I see the PSU Center helping with, is helping us evaluate ourselves, evaluating us as a state, building skill sets so that we can understand how to do that. And I think for some time, there was some thought at the very beginning, realistic, not realistic, that Theo was gonna somehow collect data in such a way that we would have that. But that was really probably, I guess at this point, we could say maybe unrealistic that something was gonna do that. So we don't have a system in place, but it would be exciting to have that for sure.
Yeah, I agree. I think that certainly is a role that the Coordination Center can help us with. Sarah or Vanessa, do you have any comments about that?
I would just echo what Elizabeth said. At first, I don't know if you noticed in my eyes, I'm like, yeah, no, we don't. Nope. So I would echo what she said. And I believe I was really excited to hear you say that is really where PSU could come in and really help and support our work. We're so fortunate that we have been able to work with Portland State University for 8 years, going on 8 years now. And the data we get from them really moves our work. And so anything they could do to help would be wonderful.
It's all on you,
Robin,
Ben.
did you have your hand up?
I did. Thank you. I'm just grateful for each one of the speakers, all of the richness that you shared. And I think one of the questions that I have in my mind is to check my own belief in the positive ripple effect that the coordination locally, when we talked about, when each of you shared in different ways, home visitors coming together, building relationships. We have very specific strategies that we've been tracking on, but one of the ripple effects that I have been thinking about, I'm really taking a while to get to my comment, is workforce wellness. So whether it's home visitors, early childhood, parent education, the wellness of our workforce is really on my mind and my heart right now. I have a belief or a hypothesis that as they build relationships with each other, spend time in training together, and start to really support each other, that the workforce retention and wellness will be better. But it's just this hypothesis ripple effect. Does that ring any bells for any of you of thoughts you might have?
I can answer that. I agree with you. I was nodding my head the whole time because we have seen where coming together, not only as early childhood home visitors, but we have these other people who are going into homes. So our family coaches with ODHS. We've got CCO case managers who are now starting to do some home visiting and going and checking as they've got these early childhood kind of programs and metrics. And so everyone coming together, sitting at a table and talking and learning from each other, I've seen a huge growth in a better understanding. We are actually even having some early childhood home visitors go with home visits with family coaches from ODHS, right? So they're working together and going out and supporting these families with their services. And then having that open conversation with those case managers at the CCO, because they have this thing called flex funds that can really help support families, and understanding like, wow, a home visitor went in. I know this lady from this program went in. They say this family needs this. We need to make sure we can support that family. So Robin, by them coming together, sitting down, learning, having a meal together, I've seen great growth in our region.
You know, the South Coast, we have many awesome evidence-based programs that only have 1 or 2, maybe 3 staff. And so by creating this system coordination where we're able to pull people together, they have more connection, they have more resources for sharing, they just have more ability to feel connected across the field. So I think that you're spot on, Robin.
Elizabeth, do you have anything to add?
I was just going to add that that is the backbone of our community of practice. Most of our meetings that aren't trainings or presentations or something, but most of them, we do what we call like power networking, like power dating, like you pick one person, 5 minutes, another person, 5 minutes, and you just kind of try to see who you connect with. And then we take hot topics from the group. What's everybody talking about this month? What's on our minds? And we dedicate the rest of the meeting to having a shared conversation. It sounds so simple, but it really breaks down the isolation that people who do this kind of family work experience, including supervisors who are maybe even more isolated because they might be the only supervisor in their organization doing what they do.
Thank you. I am just inspired by the intended and unintended consequences of this relationship-based coordination. So thank you for sharing different examples.
Well, I'm going to take the prerogative and ask the last question. We're running a little bit short on time, but and of each of you, what would it take to sort of scale this statewide, to make a statewide investment in the coordination? What do you see as that?
It's gonna take some funding, you know, having a dedicated home visiting system coordinator, as Elizabeth pointed out, to do things like creating agendas, managing coordination, supporting the teams from behind the scenes, creating the opportunities for networking. All of those things take time and capacity and are the first things to fall off if we don't have somebody dedicated to that work. You know, as I'm hearing Elizabeth talk about all of the grants that you've had to write, that also takes a lot of time and capacity. So if we're able to actually just fully fund this work from the get-go, then we're able to actually really focus on the work and move outcomes forward. And so it's going to take some funding, and then it's also going to take some really clear visioning at the state level. We have a lot of really awesome evidence-based programs across the state. However, they're not fully aligned even at the state level. And so it's going to take some state investments and potentially with the help of Beth and the team at PSU to help align the systems from the top and at the bottom. So thank you.
And I'm going to echo what Sarah said. And I think when I first heard the question, the first thing that popped into my mind is it's going to take time. My good friend, Christy Cox, who really worked alongside us, she had a statement or a little saying, and it stuck with me. You have to go slow to go fast. And it's the truth in this work. And echo Sarah with the funding. Funding that's flexible, right? My funding down in a rural area is a little different than in the metro area. We have a lot of ground to cover. And if you're not there, it's hard for people to get on board. So those are kind of things.
Yeah, I'm just gonna ditto all of that. I think it needs dedicated staffing and professional development and support for the specific skill sets and lenses that you have to do the systems work. And it shouldn't be layered onto you know, a home visiting supervisor or someone who is I think one of the things that as I've had different careers or different roles at different times, one thing that's pretty exhausting mentally is when you're going systems, family, systems, staff, like the level of support that these things need really utilize different skill sets and frameworks. So I think to do it all justice, you need to staff it all correctly.
Right. Well, thank you all for
Peg. Representative Reynolds isn't here yet, so I think we can continue a little bit longer. Christopher said he'd let us know when she shows up. And I'd love to ask a question of Vanessa. You identified travel as one of the barriers, and I'm just wondering, how did you deal with that, or how are you dealing with that?
Well, we were really fortunate. A lot of, we had the South Central Early Learning Hub had to put in funds also, right, to help support that other work. And then we just made a plan. And when we first started, I was going to those areas. I was going to Klamath. I live in Douglas, so I was going to Klamath and Lake once a month. And we would see a kind of a little drop off if I didn't go, right? So we had to just scale back and find money wherever we could find money and get little grants here and there. Really focused on putting that money in other places so we could move money over for travel. And we really noticed a hit in that. We noticed how important it was to be there during COVID. Going on Zoom, it just wasn't the same. And we just saw a huge loss of people coming to the table. And so we are just now in my region, we're just now building all of this back with a little restructuring. But you really have to have someone there. They want to be there. They want to see you. We also had some funding from McVie. And so they had, we had a person in Klamath. So that person did, I think, she was a 0.25. So she did some of that outreach in Klamath. So that was really helpful too in the beginning. And then that kind of funding went away.
Okay. Thanks.
Well, thank you so much, Vanessa and Sarah and Elizabeth. You should really celebrate all of your successes. And we appreciate you sharing your thoughts. And I think we've all learned a lot. So thank you very much.
Thanks for having us. It was a great honor.
Yeah, thank you.
Thank you.
Thanks. And feel free to stay on and join us as we say hello to Representative Reynolds. And thank you very, very much for joining us. And Peter, I thought you might want to make a couple of comments.
Sure. I also want to welcome Rep. Reynolds and introduce her as she kicks off the next part of the agenda. Rep. Reynolds has been really the champion for early childhood in the legislature. So much has happened, and you've raised the awareness of the need and the awareness of the possibilities of what we're capable of as a state. So personally, very grateful for the efforts you've led. Look forward to continuing to work with you as you head towards the 2025 session, go even larger and trying to have an even greater impact for children and families. And just a note, one of the previous conversations, you had mentioned how complicated and how did the home visiting system get so complicated, which is one of the reasons why the council has formed the home visiting committee, and we've helped to develop the coordinating center at PSU. Very grateful that you have provided your chief of staff, Christopher, now to join our committee as well as we do this work forward. What you missed this morning was a kind of great overview from each of the state agencies involved, and then from the center itself, Beth Green and her colleagues. And this last panel were folks on the ground at different areas of the state, regions of the state, talking about how this is growing. So with that, I'm going to hand it over to you to just kind of give us an update for where you see things. And again, just grateful for your work and glad to have you with us.
Great. Thank you. Thank you, everyone. Really great to be here. My name is Lisa Reynolds. I use she, her pronouns. I'm state representative from Oregon House District 34, which is pretty gloomy today. I'm actually at home today, which is nice. But probably more importantly, except for being a mother, that's probably the most important role I play, but I'm a pediatrician. And I think that, and I was in clinic all day, Monday and Tuesday. I joke that spring break week, a lot of it is like, well, he's not too sick now, but we want to go to Disneyland tomorrow. But anyway, but there are also a lot of sick kids out there. If you all have sick kids at home, you're not alone. And I've been telling families, like, your child is very unique in so many ways, but being sick for the past 6 weeks is not unique. So for those of you struggling with back-to-back illnesses, I feel you. So, but having my foot in that clinic has been incredibly valuable. And I'm gonna keep up the facade of a citizen legislator as long as I can, to really be in that clinic as much as I can when I'm not in session. And so, I will say that in pediatrics overall, we sometimes feel like medicine stepchildren a little bit. I shouldn't say that because stepchildren are actually very important people, but we are often an afterthought, right? How much do we fund pediatric care compared to, over the whole lifespan? And then I'm finding in the legislature, we may talk a lot about kids, but we don't talk enough about early childhood, right? The 0 to 5. And we all know, and it's preaching to the choir here, but we all know that if we could really invest and shift more to the 0 to 5, how many problems we would prevent: child welfare involvement, juvenile justice involvement, not being ready for kindergarten, poor third grade reading scores, all the things that we're responding to like our hair's on fire, as we should. But if we could just really shift things upstream in terms of spending and services, we could really, it's morally the right thing to do, and it ends up being economically the best thing to do. So towards that end, you know, I will say I'm a huge fan of home visiting programs. I think it is just like the secret sauce in solving and preventing so many problems. And yet the system is completely inscrutable. You know, and I will say in particular, and I've been very open about this with several of you already in this room. And nice to see you, Barry, by the way. I think I've only seen Barry in hotel ballrooms across the country for at the at some of the early.
Yeah, fair enough. Fair enough.
Yes. And now you're in some fancy conference room, it looks like. But I've met Barry several times through the Hahn Institute, and we're really lucky that there's now that he's back in Oregon with Lisa. So anyway, sorry. The Family Connects model, the universally offered home visits model, brilliant, right? I really love the idea that we don't, we're trying to destigmatize, oh, you need someone to come to your home to see your baby, right? Which is, I can imagine that's how it comes across to some folks in the hospital when they've had their baby. But the implementation has been really terrible. And granted, part of this was due to COVID, but we're several years outside of COVID. And as far as I can tell, very few of my patients, I'm a Washington County, St. Vincent based pediatrician. Like, this is the nexus of where Family Connects is supposed to be happening. And very few of my patients are accessing the care. And I've talked to the social workers at the hospital. And what I envision, and I know this is part of why we're doing this, the special committee, is I want a mom or any parent, that they're hearing about this during their prenatal visits, right? By the time they get home, they're going to be like, where's my home visit? Where are they? I'm expecting them, right? Like, this is part of what Oregon does, like what they do in a lot of European countries. So I know that's a goal. I know a lot of people are working toward that end. And I know that there are many different home visiting programs, which is kind of good and bad at the same time. It's like, who knows how to access what? It feels a little bit like it's just very hard to navigate this. So thank you so much for delving into this. We need to make it very streamlined and easy. And if that means navigators, which I have to admit, I'm not always a fan of the word navigator, because it acknowledges that the system needs an extra layer of bureaucracy to figure out how to access. But if that's what we have to do right now, we'll do that. But I'll tell you what I'm looking at, kind of, stepping back a bit bigger picture, is I'm looking at, some comprehensive maternal child health policies, programs, whatever, variety of systems. And I know Peter Buckley and his group are looking at this obviously really well. The way I'm thinking about Peter's group and the roundtable is, you guys are doing these amazing pilot programs, going deep in a community and surrounding families with everything they need. And we need to do that as a pilot, and then do that throughout for every kid in the state. I'm looking a little bit as like, what can we layer on for all kids in Oregon? That's what I'm thinking right now, actually. So in terms of maternal child care. So we're using the phrase momnibus. I'm saying momnibus 2025, but I've already come to the realization it's going to be more than 1 year. It's going to be more than one session of policies or practices or programming or funding. What I think that we are looking, as we start talking to more members in the community, is, really maternal care, and looking at everything from the moment someone knows they're pregnant through the first year of life. Is how can we surround that pregnant person or person who's going to have a child with everything they need to really thrive and to really be able to dial in that early relationship with the baby, right? I think a lot of people in this room are fans of Dave Willis or acolytes of Dave Willis. What can we do to really make sure that early relational health is as strong and as healthy as it can be? And, when I talk to Dave Willis, we talk about the first 5 years, the first 3 years. I've been focusing on the first 1 year because of the prenatal coverage for Medicaid expanding through the 1 year postpartum. Dave Willis would say the first 2 months, like if we can really like cocoon that family with everything they need, housing, nutrition, mental health services for mom, doula, substance use disorder treatment if you need it, you know, that would go a long way to preventing a lot of downstream problems. So that's what we're kind of looking at now. We have quite a few folks that we're talking to helping us with this, and we're meeting with members of the community, and we're going to be formalizing community meetings on what makes sense for 2025. But now I have a 4-year plan of series of policies. And just one thing I want to say before, because I'd love to hear if you guys have any questions, is one thing that was really important about the 24 session is we got our early childhood funding. So Nurse Family Partnership, we got 3-point-something million, Relief Nurseries, 2-point-something million. But we got those as part of the addiction prevention package. And I really want to keep this narrative up that anytime we're talking about prevention, it's got to be very, very upstream. And furthermore, when we're talking about addiction, treatment's too late, right? So we really need to be thinking about prevention on a very wide scale, both for adolescents, but also for pregnant people and babies. So I feel like there's a little bit of a kind of a shift in how we're thinking about this. This is a bell I'm ringing. You guys all ring this bell all the time, right? We need to really think about prevention upstream. And so I was really happy that the two programs I was really touting were funded. And I really liked that it came out of addiction prevention funding. So anyway, thoughts or ideas or questions any of you all have?
That is a huge shift, that the fact that people can see that connection now. And again, you've been pounding that with your colleagues, and keep pounding.
Yeah.
Anybody have any questions for the representative?
Yeah, I have a question that's sort of a comment, I guess. So part of I think, well, first of all, thank you, Representative Reynolds, for the champion and the work that you're doing. This feels to me like part of the messaging around supporting pregnant people and very young children and parents with very young children has got to be that this is something we need to do as a society for all folks in that circumstance. What I mean by that is we need to destigmatize the idea that home visiting is about for folks who have something wrong with them, who are deeply impacted. I mean, this needs to be thought of as one of the ways we as a society take care of each other. And we do that because it's what makes us stronger as a society. I know that's a hard bridge to get to, and with limited resources, we want to prioritize those in most need, of course. All that's true. But the way we think about it has got to be, this is what we need to do to support families with very young children, just from the jump. And I love your point, starting really, really young. I mean, I do think 0 to 5 is important. I get the point of 2 months, right? But we need the approach we take to it isn't that this is alms to the poor and the needy. This is what we need to do because we care about the functioning and the thriving of our society. And everyone needs it, regardless of their circumstances. We start with those who need it the most, but we are building something that anyone will be able to access should they choose to. Anyway.
Yeah, I really, really appreciate that. And it's interesting because I've been in a lot of different meetings, and, we're kind of focusing on Medicaid and how we pull down Medicaid dollars to maybe pay for, prolonged, postpartum doula care. And all sorts of people in the community and in the Medicaid world are like, we keep letting the private insurers off the hook. So, it's a little tricky, right? Because it's hard to do insurance mandates. And then when we do insurance mandates for private insurers, those who are self-insured don't have to listen to the mandate. And in my community, that includes Nike and Intel. Like Nike was not covering the university offered home visits. They are now. It's pretty nutty. Yes, Sue Berry. It's pretty nutty. So I will say that I do think a universal approach. Yeah, we will be starting and talking with communities who have the most discrepancies on maternal care, including we've been working with Black Futures Initiative. And it's kind of easier to work with Medicaid because we can make some sweeping changes for a big chunk of the population, but this absolutely has to include all Oregon families. You know, I don't know if you guys saw the Oregonian, you know, Oregon just got really high marks. I can't remember from what organization, in how we, in our policies among, you know, young kids. And that's awesome. And, you know, one of my colleagues is like, oh, I see your fingerprints on this. Like it includes, you know, the child tax credit, which is my favorite day so far in the legislature when that passed. I feel like it still feels like, yeah, we look pretty good on paper, but obviously, you know, same with like people like, oh, you have universally offered home visits when I go to national, policy meetings. I'm like, yeah, we kind of do, you know? So anyway, but yes, absolutely. It needs to be universal. And I know you guys have something at 11, so I can, Subin, I'm happy to, yes. And I think overall, like, right, our country's just terrible when it comes to little kids. Like, Oregon is on the forefront because of paid family medical leave, and which is pretty amazing. Yes, I know that a lot of people worked very hard to have that happen.
Do we have time for one comment or question, or should we move on? I'm open to either.
Sure, if it's a real quick one, Subin.
My question is really about infant toddler education and care, kind of addressing the childcare crisis, right? And so everything that you were describing, I'm all for it and want to find out how the Early Learning Council can support. But, you know, in connecting with, you know, a broader conversation about workforce, not just about the early childhood workforce, we know that infant toddler education and care is, you know, lacking in our state. So I'm wondering if there's an opportunity or willingness within the state to put some, you know, substantive attention to that.
Yeah, I mean, I think that we have done a lot. If you look at dollars spent, right? You know, we just stood up a whole new agency to focus on early learning and care, although there was just a very troubling article about the agency this morning. But and you know, each session that I've been in the legislature, we've, you know, devoted tens of millions of dollars for infrastructure. We are looking at, you know, workforce, especially through the community colleges. So we're getting there, but we still have such a long way to go. And I know, you know, I meet with AFSCME about, I really love in-home daycares, right? And so how can we better support the smaller in-home daycare providers? So I think, you know, again, like I think this big shift, I feel like it's starting to shift, but yes. And I always say work is, you know, childcare is the work that allows all other work to happen, and access to childcare is a wealth builder. You know, we want that childcare to be of really high quality. We need to pay childcare providers a living wage. It's this really weird economic conundrum that it's too expensive for families and we don't pay our workers enough. So I was unbelievably thrilled, and this is more than I expected, but the investment that the state is putting into employment-related daycare, so childcare subsidies for low-income families, I'm over the moon with how we really showed, you know, the budget as a moral document, that we truly are putting money where our mouth is in terms of giving, you know, potentially close to $160 million for the employment-related daycare over the next, you know, through the end of the biennium, additional. So I think we're moving in the right direction, but we have a ways to go.
Yeah.
Thank you for the question. Yeah.
Well, and thank you, Representative Reynolds. I'll say we're over the moon about the ERDC funding as well. But I also would attribute a part of getting that funding to the leadership that you've provided and the focus you've made on early childhood. So we have a lot to thank you for. And thanks for joining us now. And if you have time and want to stay on, you're going to hear from a group of people whom you know well, some of our agency partners.
Oh, I really wish I could. I wish I could spend the whole day here with y'all. But thank you so much. And you guys, you're kind of the wind in my sails. You guys are doing the hard work. I just always talk about the people who really helped me stiffen my spine and stand up tall for this stuff, because it's becoming easier and easier with my colleagues. They get it, but I'm really grateful for everything you all do. You all put so much, in your professional lives, and then on the Early Learning Council, how much you're doing for kids. So thank you so much.
Okay, thank you, Representative.
Take care.
Yep, you too. Okay, let's talk to some of our agency partners. As you all may know, we heard from some of your staff members at the beginning of this meeting, sort of updating us on what's some of the pieces around home visiting that your agencies are involved in. And now we really appreciate each of you being here and sharing with us what is happening in your agency around home visiting. We have a list in our agenda packet that lists some of the many programs that each of your agencies is administering. And I counted up to 13, but we know there are more happening also at the regional level. So we know we're all in this together, and we appreciate all of you joining us and sharing your thoughts. So Dave Baden, how about if we start with you and Oregon Health Authority? Thanks for being here again.
Yeah, thanks, Sue. Greetings, everybody. Dave Baden, he, him pronouns. Now the Deputy Director here at the Health Authority. Thanks for having me back. Yeah, I'm sure that Kate Wilcox went through sort of a good set of the programs generally that OHA has and is supporting in the home visiting world. But I thought maybe I would talk through sort of a little bit on the questions around about Sue, around to sort of prompt a little bit bigger discussion around sort of benefits of the council's focus on coordination of home visiting services. I mean, the fact that you said, how many programs, Sue? 14, something like that. I mean, while that's great,
a lot.
Right, while that's great, coordination of 14 programs that are getting at different aspects of home visiting for kiddos does create a coordination challenge. Even sort of in the OHA sphere alone, I mean, we've got 4 pretty solid programs that have different focuses and different things, and just keeping the eyes on keeping those things coordinated. But I think first and foremost is just just making sure that there is community awareness for family needs and how those can be addressed with home visiting. Again, like trying to make this as much people and family first, so that it's not, here's a cacophony of programs to look at, is understanding sort of what needs are and having the right community awareness so that those can be better addressed with the home visiting programs that we had. Obviously, that comes with what data is needed to understand community needs, expanded ability to reach those not currently reached by home visiting. Not, everything, at least on the OHA side, is statewide. There's sort of a mix of different counties that have different things based on funding and availability and interest. That does not lead to, it's sort of that patchwork county by county is not ideal in how all these things are done. The way sometimes we've got to do that, and just assuring that there's accountability around the work, and making sure that the levels of governance are there, so that we're meeting the needs where we can based on resources to decrease barriers to the services out there. I think really Kate and team and others of assuring that that there's coordination, and I think Kate and her team are just a really good example of really trying to bridge sort of the public health Medicaid, I say divide for lack of a better world. If I would close my eyes and imagine a health system where public health and the healthcare system actually were the same thing, there wouldn't be as much of a divide. That's not the healthcare and public health system we have in this country. But I think Kate and the Medicaid team really do a good job of making sure that the things that are happening around this work that are Medicaid funded to sort of public health funded are coordinated well. So that is, I think, just doing that alone is a lot of work. But other priorities for home visiting, just to list maybe a few. Trying to expand access to improved health outcomes through prenatal home visiting with Babies First and Nurse Family Partnership, while universally offering a postpartum visit for those not served prenatally, like the Family Connects Oregon. So again, just being able to get out there prior to birth on the prenatal home visiting and having sort of the connection from there. Making sure that the data collection is innovated to be able to provide timely data and health outcome reports to local public health, to the public and community partners so that community needs are understood and addressed. There's obviously a lot of information by having the home visiting program. How are we best disseminating that back? How is that data being used for decision-making at a local level of other public health programs that are focused on kids? Information, that would be helpful for schools. I think there's a lot of things that would be helpful to further work and expand on. The connections, as we've talked about, the innovative Medicaid waiver that we have of having 0 to 6 continuous enrollment, and how that works sort of into the to sort of the connections with the home visiting programs as all of these things sort of work through, and just making sure that works well. One other piece that I think is something that probably came up also this morning is the challenge of having public health nurses to be able to do this work. So I don't think it's a misnomer to say that there's a crisis in sort of the public health nurse workforce to be able to actually do this work. And that the nurse home visitors have adequate support by nursing supervisors, training needs, recruitment and retention challenges of public health nurses. It's not the only spot in the public health workforce that's a significant challenge, but I think the clinical side of the public health workforce is, I think, particularly acute, and that has significant implications on these programs. I think I mentioned, obviously, being very family-centered, culturally responsive, and strengths-based in these programs, and making sure that we're doing that. Obviously, funding is always going to be an issue. So how are we both assuring sustainability of funding, if there's desire for making these more statewide, increasing funding, and how much work to be able to do that, working with community members in innovative ways. And I think really it probably still just comes back to the collaborative relationships, to make this thing work. How home visiting works with having a more modernized public health infrastructure, where the roles of sort of linkages between other services. Obviously, home visiting and any of these direct touch programs only sort of, like, when there are challenges or things that people need to be connected to in the behavioral health system, or that those connections are there, and that there's availability of practitioners all throughout the state to meet needs. And this is not a discussion about lack of kids' behavioral health services in the state, but that leads to a lot of sort of referral challenges and other pieces there. So I wanted to highlight, Sue, maybe a couple of those things. Happy to answer questions. Kate, I saw you on if there's anything more that you think I should focus on, but happy to listen or answer any questions.
All right. Thank you, Dave. And thank you, Kate, for staying with us all morning. No, we appreciate your comments, and certainly OHA is obviously a very critical leader in this whole system building for home visiting. So let me go next to Fairbores, and thank you for joining us, Fairbores. We're excited to see all of the home visiting programs that you guys administer.
Good morning, Sue. Hi, everyone. Great to be with you. And I'm sorry that I wasn't on earlier to hear all the comments from everyone around what's happening around the state with the various programs that we have through our different agencies. I know Mary is on, and I appreciate her presenting for us. I know that she most likely talk to you about the work that we're doing, with the tribes, how we're trying to utilize the 4E funding, etc. As I just reflect on what just Dave shared, naturally, we still have a lot more questions than we have answers. And I think one of the major challenges that we have is how do we actually coordinate? I think this is the word that Dave used. How do we actually have a comprehensive strategy around home visiting and a holistic approach that integrates services across systems? That is our biggest challenge, not only in home visiting, but on many other fronts. You know about our Building Wellbeing Together initiative, which really is focused on how does that holistic support look like, and all of the various needs that exist within a community. So what does a holistic home visiting program between DELC, ODHS, OHA, developmental disabilities programs, because they're primarily run by the counties, the coordinated care organizations, because pretty much every child is covered by them, would look like with a broader focus on core needs. What kind of public benefits these families need? What about housing? What about transportation? How can we actually bring these things together to provide a pathway to success for families? And for us, that really is central, because many of these children and families stay with us through the trajectory of life. Just 2 weeks ago, I was with the Klamath tribes, and we sat with 5 mothers and grandmothers, a combination of mothers and grandmothers. Every one of them had experience in the child welfare system. 2 of them had 8 of their children taken away. It was a painful experience to look at this intergenerational cycle. So what could we have done better? And we are doing work with the tribes, and our approach to home visiting with the tribes is completely different than any other population, just because of their rituals, because of their specific needs, etc. But it's something fairly new when we talk about home visiting. This is not something that was happening at the time that any of those individuals that were talking to us had the benefit of those services. Now, the other thing is, what are the redundancies that exist among the various systems and organizations that touch a child or a family? It can be very costly when you look at the redundancies that exist. And maybe Mary shared this with you, but we became aware of some of the redundancies through, again, interacting with the tribes and investing in what is called family spirit training with the tribes. It became clear that there are other systems and agencies that are partnering with the tribes around the same concept, that family spirit implementation, that they're moving forward. So as we continue to increase our investments in home visiting, the various programs that we have, including trying to leverage as much 4E prevention federal funding that we can use, and you heard about that earlier. How do we actually put that in context with the investment that is already being made by Oregon Health Authority, by DELC, by some of the philanthropic organizations with major investments in home visiting services? If we can actually do that, if we can bring these things together, then I believe that we can have a better opportunity for improved outcomes. Again, it could be just in that time frame, or it could be across generations. We can experience better child development. I'm confident that we can see a reduced maltreatment risk in those families, increased access to some core services, and at the same time, eliminate duplication and optimize resource allocation. I think that we can do much better in sharing data. That's one of the sticking points right now. We as a state agencies, and I'm calling us and my partners, we are reluctant to share data. And we need to share data to begin to understand the holistic needs that those children and families have, so that we can begin to identify the gaps, we can begin to identify the bridges that we can build, so to avoid families falling through those gaps in between systems. As we all know, home visiting can also serve as mechanism for early detection of needs. It can lead to timely referrals so that we can put support around the family. It can help with early identification of developmental delays, whether it is developmental or intellectual disabilities. And many of the families that we serve have challenges with those within their own families. It can also, again, if we can work together, we can collectively advocate for cross-training. Among our professionals, Dave talked about the nurses, public health nurses. You know, we have nurses within ODHS, we have family coaches. How do we actually bring all of those together so that collectively, again, it's a case management approach. What does this family or what does this child need, and how can we come together to basically connect our services together to address the holistic need of the family? And then finally, as it relates to really tribal sovereignty, again, that's a completely different environment. But if we can align our investments in home visiting services through our various agencies, we can allow tribes to maximize federal funds. Quite often, they directly deal with the federal government. They're running some of their own home visiting programs, regardless of what we're doing and where our funding is coming through. So really, my key point today is building a comprehensive approach across our agencies. And it is difficult for particular state agency like ODHS, OHA, or education to do this on our own, because we are a player in this system. We need a convener to actually help us, bring us together and help us with that statewide vision. And then we can deliver on based on that vision. So again, maybe it's ELC, maybe it's maybe it comes from the governor's office, and more importantly, maybe it comes from the community that we're touching, the tribes, those that are being impacted by our services. So that is my pitch for today.
Thank you, Fairbours. Wow, that's a large pitch, but very comprehensive, and certainly what we're talking about. And you kind of pinpointed why the council is on this very focused commitment to standing up this coordination center at PSU. And thankfully, we have several of your staff members, your leaders, involved in this coordination center effort, including Mary, who's a great representative, but also a real leader and thought leader in these conversations. So thank you. Interesting, Council. We hear about data from every single presenter. So it's certainly something that's high on everyone's list. And I'm sure Beth will be on top of that in the next few months. Thank you. Now, Dr. Williams, we appreciate you being here. Good to see you again. And we would love to welcome your comments.
Wonderful, thank you. I have to echo the comments of my colleagues who've gone before, both Dave and Fairbours, around just the collaboration and coordination is just critical, especially the way it lands on our families, our communities, the way we support the 9 sovereign tribes. Those it's key. This is, you know, the making of a coordinated care service model when we are able to collaborate in this capacity. And again, I'm always going to give credit to Kara Williams and team who prepare me with good notes and have really thought deeply about the power of home visiting. And so I'll share some of the points that the team have shared. As far as the benefits of this coordination, I think, you know, we've definitely touched on many of these, but when we coordinate home visiting services, it supports the public's awareness of ODE's early intervention services for families with infants and toddlers with disabilities. And it helps us with child find efforts to ensure eligible children receive the services that they need and deserve. Collaboration across the programs will increase programs' understanding of the different home visiting options across the state and the services they offer, so we can get coordinated and aligned in our approaches and compare notes. This will boost the ability of our programs to direct families to the services that best fit their needs. This can lead to increased referrals to early intervention. And if a child doesn't qualify for early intervention, better understanding of other available home visiting programs by early intervention personnel will support them in referring families to other relevant programs so that our families don't end up falling between the cracks. Coordination between home visiting programs can also lead to opportunities for shared professional learning on topics relevant across home visiting workforce, such as infant and early childhood mental health. Increased opportunities for relevant high quality professional development can lead to consistent use of effective practices and ultimately better outcomes for children and families. Additionally, the collaboration of home visiting programs at the state level will provide the guidance, you know, that we've been speaking to, a model for collaboration within our state regions. Regional collaboration will support programs and working together to address local barriers to accessing home visiting programs. And so in terms of other priorities for home visiting at ODE, our priorities include just increasing awareness of our early intervention services for infants and toddlers with developmental delays and disabilities, ensuring families just know how to access them, that the barriers are removed, ensuring equitable access to early intervention services across the state, supporting recruitment and retention of early intervention personnel, and increasing the diversity of the workforce that provides early intervention home visiting services, increasing practitioner capacity to address the social emotional needs of infants and toddlers receiving early intervention. For example, implementation of the pyramid model in early intervention home visiting and supporting practitioner endorsement in infant and early childhood mental health. ODE prioritizes home visiting as a component of our student success plan programs in order to provide more culturally specific services. For example, through the African American Black Student Success Grant Program, the Black Parent Initiative has used home visiting to implement the first 1,000 Days program, which utilizes the parents as teachers and Born to Learn curriculum. The parents as teachers model for providing family services to families with children from the prenatal period to kindergarten has been tested by rigorous peer-reviewed studies and shown to produce results including increased parent knowledge of early childhood development, improved parent practices related to childhood development, increased ability to detect developmental delays and health issues, and increased school readiness and success for children. So some of my colleagues earlier who were just projecting better outcomes and better experiences for parents and families with the coordinated use of these programs. The home visiting programs, kindergarten transition work builds on programming with younger children and introduces them to increasingly sophisticated, developmentally appropriate activities designed to prepare students for kindergarten. And to date, parent educators have had 168 home visits. Another important part of the Black Parent Initiative's work is having doulas deliver culturally specific childbirth education to pregnant African-American Black women. The African-American Black Success Plan grant has also supported Lane ESD in partnering with United Way to provide monthly income visits for families of children birth to pre-K to share resources, early literacy, math game strategies, and support access to pre-K programs. Participating families receive minimally one book and learn one game each month. And we continue to prioritize home visiting as a strategy to engage parents and facilitate a smooth start to kindergarten through our Jumpstart Kindergarten Initiative. Schools must offer 10 hours of culturally responsive family engagement activities, which could include home visits by kindergarten teachers. The ODE Jumpstart team offered 2 3-hour home visit training sessions in spring of 2023, conducted by the Parent Teacher Home Visit Organization, and 70 administrators, teachers, aides, and early learning practitioners attended. And home visits during or after the Jumpstart program provide one-to-one opportunities for school staff to build relationships with families and listen to the family's hopes and dreams for their child's educations. So home visits help both the educator and the child feel confident and successful in the classroom. And I have to tell you, visiting the Jumpstart program in Centennial this summer, I mean, if you need a bucket filler, go by and see these babies getting ready for kindergarten, and to be next to a kid who's literally in the process of understanding that 100 isn't the highest number you can count to. And we go, well, what about 101? And he goes, 102? 103, and just the light bulbs, so he's going to have a good time in school. And that's because of the programs like Jumpstart and that kind of thing. And, I'm a math teacher, so that really geeked me out a little bit to see a kid getting excited about numbers. So that's the report from ODE.
What a great example, Dr. Williams. Oh, kids are the best. They make us smile. Definitely. Thank you. Great overview. Now I want to welcome Cooper Brown to our meeting. I think many of us have met Cooper. He's the Deputy Director at DELC. Alyssa, our fearless leader, is on vacation this week. So Cooper, thank you for representing Alyssa and the department today.
Thank you, Sue, and hello all. Nice to meet those of you who I haven't had the pleasure of meeting, and good to see all of you. As Sue mentioned, yep, here to represent the agency. My name is Cooper Brown. I am the Deputy Director for Operations for the Department of Early Learning and Care, and I use he, him pronouns. Wanted to piggyback on some of the comments that the other directors and executive leaders provided. And so some of this is going to be echoes of what you've already heard from Dave and Fairbours and Dr. Williams. But we too at DELC are excited about the Home Visiting Coordination Center and the concept. In general, we see a lot of benefits for the work. Of the 14 programs, I believe you said, Sue, that provide home visiting services, I believe we have 3. In OPK and Relief Nurseries and Healthy Families Oregon. And Gwen was providing me some stats just a moment ago on how many home visits we've provided through those services, through those programs in the 2022 and 2023 program year. Across those 3 programs, upwards of 13,000 home visits. And then when you add in the federal Head Start visits, it's closer to 20,000. So significant piece of our programs, really, when it comes to home visiting, and a great opportunity for us to, as others have said, coordinate across all of our various programs across the enterprise and across the state. And I think having a third party, non-program specific entity it is going to, like others have said, really support all of our agencies, address and coordinate all the different strategies that I know are articulated in Raise Up Oregon. And it'll also, believe, be a vehicle for the Home Visiting System Committee recommendations in ensuring that those actually come to fruition. The Home Visiting Coordination Center concept also, I think, will bring a lot of value by providing an intentional research policy kind of practice nexus and connection and feedback loop that, of course, will benefit the entirety of the home visiting system. And I think will provide a bit of that connective tissue between the programs and implementers as well, and also between the steering committee and home visiting system committee. So see some value there as well. I'm sure that Gwen's already mentioned, but there's also value from our perspective in the fact that it provides a framework for innovation and transformational implementation strategies and a way to explore and test those. So some great value there. And just in general, as mentioned, and as you've heard from others, a lot of value from raising the focus up above agency or program specific outcomes, and really seeing the entirety of the system through that end user perspective, and through those that we serve's perspective, through the family perspective. The other pieces that I would add in terms of benefit have already been articulated by others that Dave Fairborst and Dr. Williams have already mentioned. But this work will help ensure that families really know that full suite, as Dr. Williams mentioned, of programs and supports at their disposal that they can leverage and to meet their needs. I think it's a great opportunity as well to reduce that duplication of effort across state programs, and ensure that we're really using our limited funding to its best benefit, and that's well spent, to Fairborst's comments. And as you mentioned, Sue, we also see some value in enabling that crucial data collection and sharing that's so pivotal to ensuring that our programs are aligned both internally to our agencies and also across agencies, and just strengthen that coordination across all of our programs and services. In terms of what are the other DELC priorities for home visiting, it's a key strategy for our early literacy objectives, as I think all of you know, and we're going to continue to refine those recommendations based on community input for our 2024 Birth Through 5 literacy plan. It certainly aligns with our priority for supporting the home visiting workforce through compensation and professional development opportunities. So a great deal of alignment there. We see it as integral to increasing access for communities disproportionately not accessing services, or who haven't accessed services in the past, partly through the diversification of the home visiting workforce. And so some great alignment there. And finally, it promotes all of our home visiting programs, as I've mentioned, in the 3, through that really whole system lens. And like I mentioned, ensures that all of the families are aware of the options that they have, both through our programs and through the other state programs to meet their needs. So I'm sure Gwen can provide more detail, and I might ask if there's anything that I missed there, Gwen, that you want to make sure we hit. But otherwise, at a very high level, that's our report to the council. So.
Thank you, Cooper. And Gwen, would you like
thank you, Cooper, so much for sharing that from DELC. And since I was on the panel, I really appreciated you stepping in. I did want to just clarify something, and the numbers are a little bit staggering. So actually the numbers Cooper shared were how many families and children were served. But if we were to look at actual home visits, both OPK and our Healthy Families Oregon program in program year 22-23 served just over 29,000 or provided 29,000 home visits each. So the numbers are quite higher. So thank you, Cooper. That was number of children and families served. So just wanted to make sure since we're on record here. Thanks.
Thanks, Gwen.
Thank you, Cooper and Gwen, again. All right, council members, this is our opportunity to talk with our partners, ask questions, make comments from your own perspectives, professional or regional perspectives, and certainly invite our agency directors to talk as well, add more, or talk among yourselves as well. So, any questions, comments? Peter.
Well, thanks, Sue. I have a comment and question as usual. It's amazing to see all this coming together, and we had the discussion in our last meeting about the CCO's social emotional metric, and I remain curious on how we're going to continue to merge things together so to make sure that the CCOs are talking to the education providers, in particularly in every region, and aligning their efforts. And I guess for Dr. Williams, one of the questions I have is I loved hearing about the Jumpstart program. I hope we can get more schools and school districts interested in doing the Jumpstart program. I'm curious about the transition into kindergarten. How is that going now? The last time we had a presentation, I think it was called the Early Childhood Education Transition Program. I'm not sure what the title of it is now, but how's that rollout going now?
Thank you. I'm sorry, I was trying to unmute. So our team continues to work with, and if you're referencing the EI, ECSC, we received some more support to kind of stabilize some of the resources so that we can help our littles transition. I'm happy to get back with you and give you more of an update in terms of the particulars, but we know when students have a strong foundation in these programs, the handoff to K-12 is going to be much better, much easier. So that is, our team is, hard at work. We have some points of celebration in terms of how our students are growing and showing readiness for kinder, but there's more work to do.
Thank you.
Okay, thanks, Dr. Williams. Other questions or comments? Robin, I think I saw your hand up.
Yeah, it was very helpful. Thank each of you for sharing from your perspective and your departments, agencies. There was a lot of conversation or comments made about data sharing and data in general, and it's something that we continue to grapple with in our state. Sharing data across when we have the blend of the data. So the health complexity is the most current example that comes to mind for me, where we have an opportunity to look at a population and how families might be experiencing a variety of social complexities and health complexities. But that is just an example. How can we, what is needed to really make sharing data across agencies and accessible to communities to utilize in their local strategies, or even in this project at the state level and local? What can we do better? What can we do to make that data accessible and usable? I hear everyone wants to, and then I wonder, why is this so hard?
Great question. So what's the answer to that, agency partners?
Such a simple question, Sue.
Right.
Yeah, I mean, I think the only, and I'm not sure how much the Early Learning Council sort of has delved into the community information exchange world and work that OHA and CCOs and others are spending a good amount of time with. And there are examples of sort of closed loop referrals that happen in these community information exchanges that allow better data sharing in sort of a health care world that I think as part of our overall 1115 waiver work, there's a big push for expanding that into housing providers and other pieces. I bring it up not as the solution because I don't think it, but I think it is a spot for local community organizations, medical community, and others to have more opportunity, at least, for sharing client level type data back and forth. So Robin or Sue and others, happy to have sort of our Susan Otter or one of our team members come and talk about that, and sort of in light of like even this conversation or others, and how it could be sort of successfully utilized. Yeah, I think on the information exchange between executive branch agencies at the state, at times it's like, wait, do we actually work in the same state? Or so I feel like we haven't, I don't know what, but yeah, that is definitely a nut that still needs to be better cracked than it is. And it's not saying that, of course, there are lots of data agreements. Fairboards and I probably sign a new one each week, I think, of some sort of agreement sharing, but like, it's a lot of work to have sort of the right data sharing between agencies, sometimes within OHA. It's hard to, so I know maybe I'm just I don't have an easy solution. I mean, data security, especially when it comes to healthcare data, is a real thing. And how then that can be balanced in wanting to do better in this, it's particularly difficult. Lots of, continued sort of cyber attacks and other things make this potentially even harder to do this. But anyway, I think the community information exchange might be an interesting spot to work in, Sue, if you guys haven't sort of delved into that world at all. I saw Peter shaking his head because I know he and and I think Allcare and others have done some work in that as well.
Yeah, the council has not touched that I'm aware of. So thank you, Dave, for mentioning that. And Peter, it sounds like you may already be involved in that or aware of it. Yeah. So Fairboards, do you have any thoughts about this, since you and Dave are signing weekly information agreements?
I see that Cooper had his hand up, so I'll defer to him, and then I'd be glad to chime in.
Okay. Thank you, Cooper.
Thank you, Sue. Sorry there for Fairboards. I think it's a great question, and I certainly don't have the specifics of some of the challenges in this space, but I can speak a little bit, Robin, to your question from what I've experienced in my current role and elsewhere in other state agencies, as some of the challenges that I think really come to play when we talk about sharing data. I think sometimes it's the security pieces that they've already articulated, and kind of who owns the data to ensure that. And I think there's a lot of risk aversion at times when it comes to security between extending, and rightly so, extending data across teams and recognizing the requirements for maintaining that security. I think there's some technology components that often hamstring us when it comes to data and different systems that don't just real seamlessly coordinate and share things automatically. I've also experienced a good deal of challenges when it comes to getting data timely and the need to scrub it and validate the data to make sure that it's really actionable and usable, and not give kind of premature data that isn't accurate. So for instance, I used to work at the Department of Transportation, and we had a big challenge there getting crash data timely from other partners in government. Because of the need to really scrub that and make sure that it was accurate. It would be at times up to years before we actually got data that could then inform our decisions and help us make program decisions. So at a very high level, I think all of those things come into play and make it so complicated. But I also wanted to just flag, happy to get more specific, and if the council would like for our team to come back and give you some more concrete and better examples of those challenges, would be happy to. So just wanted to make that offer as well. So thanks, Sue.
Awesome. Thank you, Cooper. Fair Boars, I'd love to have you weigh in, and Dr. Williams, if you want to, and then Subin, I see that you're waiting.
Sure. There are multiple barriers. There are barriers from the feds in what can and cannot be shared, whether it is CMS, whether it is FERPA, it is some of the other things that we're trying to clarify. And then naturally the other barriers are ourselves, and love our attorneys, but from the risk management perspective, like sometimes telling us what we can and cannot share. I know that Department of actually Enterprise Information Services, which is the State Chief Information Officer Office, is working on a data sharing framework. There are also some tools that are becoming available that makes this thing a whole lot easier, meaning, in currently or in the traditional environment, you would have to move data from agencies to a central place to be processed, analyzed, etc. There are now tools that are available that do not require the moving of data. We have acquired a couple of those tools. They're not operational yet, but within the next month or so, we hope to be able to see that implemented and in place. And then I would say that some of you know about OCID, the Oregon Children Enterprise Database that OHSU has right now. Many of us are contributing data to that. The only way that that happened was that our previous governor basically said to the agencies, you will do this. And it happened. And we cannot get that same data that is going to OHSU right now, because nobody has said, do this and give this data to a team that we actually have within ODHS, Oregon Data Enterprise Analytics, that can really get to the individual level. We're working on it. Again, Dave and I, the same systems have our data in it, and we work together and we share data. I should just share with you, Peter knows this, we're working with and Dave knows this as well, we're working with Rogue Community Health in Southern Oregon, William North, their CEO, and we're simply looking at the population that Rogue Community Health serves, that also OHA and ODHS are providing services to. And even in that framework, we are having an issue trying to exchange data between our agencies. We are trying to overcome that. So I think that we are entering into a new environment. We are having a conversation with the feds as well to see if they can somehow ease up on some of their data requirements, because there are tools in place today that confidentiality can be maintained to 100%, so that there should not be any concerns around that data being used. And frankly, we even share some of that data with some of our contractors, Deloitte, etc., that own our major systems. So, Robin, I would say we are working on it. We can use help, and we also have conversations with our system partners and at times with the governor's office to help us overcome some of these challenges. So it's work in progress.
Thank you so much for addressing that. I really appreciate it. I feel like we owe it to our families. We collect so much data, and it's such a powerful neutralizing conversationalist. Like with data helps us to build bridges by being this neutral thing in front of us. And so thank you so much for speaking to that.
Yeah, thank you. And Robin, thanks for the very thoughtful question. Sue Ben, thanks for your patience.
Yeah, I'm gonna keep on with the data conversation. I'm gonna say a few things that are probably ignorant because I don't quite know how like everything that we've been talking about in the last 5 to 10 minutes has been like new information for me. So I'm learning about all this. But one of the things that I think about given this conversation is our Raise Up Oregon implementation team and what they're supposed to be working on. And one of the things that they brought up was a data dashboard and putting that together. And I'm wondering if they're like hamstrung by everything that we've been talking about. Like, is there anything actually that they can put together? And the other thing that I wonder about is every agency seems to have, a set of priorities that they're working on. So in one of our previous meetings, we heard from HEC, and they were talking about how they were trying to reduce unemployment, right? And meanwhile, when I look at page 40 of our Raise Up Oregon plan, and I see HEC, all of our goals are about building supply, not necessarily about reducing unemployment. And I'm not saying that they shouldn't be focused on reducing unemployment, but we have goals in our Raise Up Oregon plan that I don't know if we're actually collecting data on that or if we're, tracking that. So it's more a comment than I guess there's a question in there around like, how is our Raise Up Oregon implementation team doing? What do they need to, fulfill that promise of interagency coordination and tracking data? And so, yeah, sorry if it's mumble jumbled. I'm still like trying to figure this out.
I think it's a really good question, Sue Ben, and we're actually going to talk about the dashboard at our April meeting to get an update from ROIACT. So it may be better to just offload that for a month. But yes, and we should thank ROIACT at this point. I think the directors who are on this call know that you have staff people who meet monthly to look at how to implement Raise Up Oregon as a strategic plan. So we use your staff people all the time through the plan, but also through the Home Visiting System initiative. Your staff members are critical for moving this initiative forward. So we appreciate your support of their involvement in this very much. Any final comments from anybody?
Just a quick note to Subin's point around data and is the answer no? Can we do nothing? I think it's about the layer of data we're talking about. Client level data exchange about a specific child and their needs, et cetera, becomes definitely through federal policy, some of our state, harder in terms of sharing agreements. We will have, when you get to a higher level of data around like populations, those kinds of things, that data is a lot easier to share and discuss and disaggregate because now we're not talking about a particular family. And the other thing about data, I just want to note that some of our families are very nervous about who has access to their data. And so for DHS, for example, in an education system to have immediate access to certain things, there's some trepidation and, kind of some historical and cultural concerns that are also needing to be weighed in this discussion. So I just wanted to add the 2 cents, but co-signing with everyone else in terms of there are barriers, FERPA, all the other things that we'll have to be mindful of and get, specific about where can we just capitalize on directory data that most people have access to versus that case management, coordinated care level data that many of us want to do.
Okay, thank you, Dr. Williams. Very, very good points. Good points.
This is Marie Simon.
Yes.
May I make a quick comment?
Yes.
I think just in general, I heard from a lot of the directors today around a desire for interagency collaboration and working towards that. And it sounds like one of the collaborative opportunities is around data, which is exciting. And obviously there are some challenges with all of that. But I guess I just wanted to maybe flag an opportunity for us to follow back up and bring this up as a topic, later this year, or I'm not sure what the right timing for that is, to see what kind of progress on some of the collaboration that was mentioned today by the directors. How are we prioritizing, or should say, how are they prioritizing that in their agency? And maybe a report back would be just exceptional. So this is very exciting.
Yeah, thanks, Marie. We will put that on the list for sure. So on behalf of the council, I want to thank Fair Boards, Dr. Williams Cooper, and Dave, who had to leave for another meeting, but we really appreciate you joining us today and sharing information about home visiting in your own agencies. And we also appreciate the work that you do every day to support kids and families and their well-being in the state. So thank you. And council, we will now take a lunch break and be back at 12:30 to talk about the legislative session. Good afternoon. Hi, Robin. And I mean, Dana, how are you today?
I'm well, thank you.
Thank you for joining us. We appreciate you making time for this slice, especially during spring break. Okay, we are all gathering again. And Gabby, I'm just wondering if, will you just put the screen back up with, yeah, thank you. Looking for Peter, Peg, Ruby, and Katie, Liz, and Maria's on the phone. Okay, great. So are we back live, Gabby?
Yes, sorry, not sure what happened with my sound. And some folks are here, Sue, their cameras are just off while they finish eating their lunch.
Yeah, that's fine. Thank you. Yeah. So council, as we get started with this afternoon, another exciting part of our meeting, I just want to let you know that Cooper Brown, whom we just saw representing Alyssa today, has written a statement in response to the article that has appeared in different news media. And it reiterates DELC's commitment to racial equity and justice. And I think what I'm going to do is ask Gabby if she'll send that out to council members, probably just following this meeting, and then also post it with whatever council meeting information you post. So it'll be part of the record. So thanks, Gabby. All right, let's kick off with some very positive information coming from our friend and ally and partner, whom I'm guessing everyone on the call knows, Dana Hepper with the Children's Institute. She is the Director of Policy and Advocacy for the Institute, and really has done a remarkable job of leading and coalescing a very strong in the group, advocacy group, the Children Early Childhood Coalition for the state. And I think, Dana, we saw the impact of that coalition in the short session. So I attribute a lot of the good news you're going to share to the work that you've done in pulling that coalition together and providing the leadership for it. So we are indebted to you. Thanks. And thanks for joining us today. So Dana is going to give us an update on the short session.
Thank you so much, Sue, and to the Early Learning Council for the invitation. Gabby has some slides that kind of summarize what was accomplished in this legislative session for young children and their families. And I also will put a document in the chat that links the accomplishments with the goals outlined in the Raise Up Oregon strategic plan. So you can kind of see how the legislature hopefully is playing a role in advancing the objectives laid out by this council in that statewide plan, in case that's a useful tool for you. And I believe Gabby has added that to the packet materials that you have as well. So as Sue said, I'm Dana Hepper. I'm the Director of Policy and Advocacy at the Children's Institute, and we have the joy of convening the Early Childhood Coalition, which is a statewide coalition of early childhood advocates, providers, allies, that comes together with a shared agenda of proposals for the Oregon legislature to consider when they meet each year, which we did this year. And in 2024, we had quite a long list of requests for the legislature for just a 5-week session. But we just felt like there was a lot of really important unfinished business from 2023 that urgently needed their attention, and thankfully they agreed, and we made some great progress this session. So I'll give a quick overview of that across childcare, early learning, and family support. Next slide. So in terms of childcare, I'm sure you're all aware that Oregon's childcare subsidy program, employment-related daycare, was running a estimated deficit of at least $99 million. And that would have left the wait list for the childcare subsidy program in place. So this was a top concern for advocates. And the legislature made really significant headway. They released $99 million to the Department of Early Learning and Care to address the known shortfall now. And they also put an additional $72 million in a special purpose account that is set aside to allow them to address any additional shortfall if that grows over the course of the biennium as families enroll in this program, families that are not subject to the wait list. And we hope as advocates that if there's any remaining in that 72 million, that it will be used to pull some families off of the wait list and get them the childcare services that they desperately need. So that was a really big step and the biggest budget allocation made this legislative session for early learning and care. The second proposal that was successful was a proposal to connect childcare with CHIPS Act grantees. And we asked for $8 million and we received $5 million that will do two things. One is it will provide funding for childcare programs to be established or expand in communities where there's a CHIPS Act business getting federal funds. So it will help them meet the childcare requirement in that act. And then second, it will support subsidies for the construction workforce who will be building those new facilities to manufacture chips. Finally, we asked for a little bit more funding in the infrastructure fund. We asked for some general fund funding and we didn't get additional funding. So we're left with the $50 million that was allocated in 2023, which is still a good start. Next slide. In terms of early learning, we also made some good headway. The legislature had allocated $9.4 million to be spent on birth to 5 literacy strategies, but they set it aside waiting for Department of Early Learning and Care to come back with a plan. So the legislature embraced the Department of Early Learning and Care's plan and released those funds, half of which will go to the Early Childhood Equity Fund and half of which will go through early learning hubs through the Kindergarten Partnership Fund mechanism. The second thing they did in early learning was restore a $22 million cut to early intervention, early childhood special education that provides services for children with disabilities and delays. And one thing I want to note here is, as I was looking back through the Raise Up Oregon plan and looking at what we accomplished this legislative session, you'll note that not all of these investments go to the Department of Early Learning and Care because our children are served across multiple state agencies. So this is an example of funding that runs through the Oregon Department of Education, but that is critical for serving young children birth to 5. Finally, one of the goals in Raise Up Oregon is to launch this early learning scholarship program that was expanded in the 2023 session to also include early childhood behavioral health providers. So this is a scholarship program that exists in statute only, but has never received any dollars to actually be implemented. So we're asking for those dollars to be implemented. That is a 2024 goal of the Raise Up Oregon plan. And once again, the legislature failed to invest in this program. So we'll need to keep coming back to them for this one. Next slide. And then in the family well-being category, the legislature made some key stabilization investments in the relief nurseries at $2.7 million. And they also invested in Nurse Family Partnership with $3.2 million. Again, that's a Oregon Health Authority program, but critical for young children. And this $3.2 million is really important because it shifts the responsibility of funding the local match. Nurse Family Partnership is largely funded by Medicaid, but Medicaid has a match that communities need to fund. That has been funded by counties in Oregon, and this moves that funding to the state. So this is critical for accomplishing the Early Learning Council's objective of expanding access to home visiting programs. because we're going to be inherently limited if we're relying upon county budgets to fund that match. But having the state funding the match gives us a little more chance to look toward expansion of nurse-family partnership. The legislature did not fund stabilization funds for Healthy Families Oregon this time around. Any questions on those legislative outcomes? All right, next slide. I also want to highlight that this work of working with the legislature is not only about getting the win, it's also about building community capacity to be excellent advocates and raise our voices for early learning and care and health. And so this legislative session, it was great to see 25 organizations join in support of a comprehensive legislative agenda. We are always listening we're trying to be thoughtful about what we say to legislators to make our case, and then we're listening for whether they say those things back to us. Like, is our messaging catching hold? And is it resonating? And I would say this legislative session, it certainly did. The legislature was very focused on addressing immediate crises in housing and addiction that feel very urgent across our state. And yet our case was that these stories of Oregonians and decades of research tell us that these housing and addiction crises are often rooted in trauma experienced in early childhood, and then investing in proven services for children prenatally through age 5 and their families improves equitable opportunity now and prevents future challenges. And we cannot afford to backslide on the progress and promises from previous sessions. And so we really heard legislators recognizing that all of these immediate crises are rooted in childhood, and that it's going to be a losing battle if we only focus on the back end, that they have to prioritize prevention. And they did that this session with the investments I've outlined, and we heard them talking about it and recognizing that they need to do more as they look ahead to 2025. So that was, I think, a really important win for this legislative session that isn't more money or more kids served, but is building of support and recognition that tees us up for continued good outcomes from the Oregon legislature. Advocates hosted our first legislator briefing with 15 legislative offices attending and 88 overall attendees, so 73 advocates along with the 15 legislative offices. Great stories from the families and providers who are most impacted by their legislators' decisions in the session. So that was really great. And you can see there we had partners hosting lobby days that partners participated in and providing testimony. Sue, did you want to say something? Sorry.
Yeah, I was just going to say, Dana, that your point about prevention and having some of the funding come from the addiction prevention focus and bill in the short session was something that Rep. Reynolds talked about just a little bit ago this morning when she joined us. And she's very excited about the fact that there's legislators are starting to connect those dots, which is exactly what you're also talking about. So yes, she made the same point.
Yeah, absolutely. I know you all hear from providers on a regular basis. Many of our early childhood programs are working with families where the adults in the families may be experiencing lack of stable housing, substance use disorder, mental health challenges, and these early childhood programs really have the opportunity to break intergenerational cycles and stabilize whole families at a really critical juncture in their life when they have a new baby or pregnancy. So it's great to see legislators recognizing, I think, what we all hear frequently and know deeply.
Right. And it's interesting also, Dana Fairboards was on our call earlier, and also talking about the intergenerational cycle and the importance of breaking it or establishing a positive one. And he was actually connecting home visiting programs as one of those prevention services that can really make a difference in breaking that cycle. And I just wanted to mention for council members to know that Dana is involved in Rep. Reynolds' Momnibus bill packaging initiative, whatever the right word is. So we'll be working very closely with Dana and with Christopher McMurrin, who was Rep. Reynolds' chief of staff, who was on our call earlier, as this Momnibus bill is put together.
If I could mention just a couple more small things that weren't a part of the Early Childhood Coalition's agenda, but I do think were really important progress this session. One, there was $660,000 allocated for the Child and Adult Care Food Program to stabilize the sponsor organizations that allow home-based providers to have access to federal funding to support the food that they serve to children in their childcare. So that was, I think, a really critical step, aligned with Raise Up Oregon objectives around food security and nutrition. There was a work group established on children's behavioral health, specifically focused on the workforce in children's behavioral health and how to build that, which I also think is a key part of Raise Up Oregon. There was some direct funding allocated for three early childhood facilities. Ollie Court in Eugene, which is a co-located affordable housing and early learning center project, received the final 1.5 million it needs to get across the line and be fully funded, which is, this co-location idea is a key piece of Raise Up Oregon. And Clackamas County Children's Commission, the Head Start provider there, received $5 million, partially for their Milwaukee Head Start Center and partially for their Marylhurst Center for Children and Families. So just wanted to lift up those few other investments that I think are also aligned with the goals that this council is striving to achieve, and that advocates are working alongside you with legislators to get those needed investments and policies made.
Super. Thank you, Dana. What a great update. Great accomplishments and progress. So I think we all have lots to celebrate and also lots to build on as we look ahead to the 25 session. And we appreciate you aligning some of the outcomes of the session with Raise Up Oregon. We always like to go back to that and have that be our North Star. So thanks, Dana.
Thank you.
Okay. So let's move on with our agenda, and we're going to hear from Jordan. There you are, from Jordan, about the Child Care Development Fund, which, Council, you remember, is one of the biggest federal funding sources that we have. So Jordan, welcome. We appreciate you being here today.
Thank you so much for having me, and so good to see all of you. Those were some really incredible updates as well, Dana. I'm really grateful that I got a chance to hear them. So very excited to be here and to talk to you about some exciting updates that are happening with the Child Care Development Fund. As a reminder, I know I've been here when we were talking through the transition of the Oregon administrative rules with the employment-related daycare program. But I'm back again, and my name is Jordan Pargetter. I'm the Child Care Development Fund, or CCDF, administrator here at DELC. So I'll go ahead, or actually, I think, Gabby, you have the slides, if you wouldn't mind switching to the next slide. Thank you. So as Chair Miller was just speaking to, the Child Care Development Fund is a federal grant from the Department of Health and Human Services, Administration for Children and Families. We're going to talk a little bit around the next cycle of the Child Care Development Fund state plan today, as well as some changes to the federal rule itself that just happened. And it's really important that we're talking about this today, at least as an overview, just because it's the first time in 10 years that this rule has been touched, so or altered in any way. So it's fairly significant. I think we can go ahead and go to the next slide. So first things first, Oregon's triennial CCDF, or Child Care Development Fund, state plan submission is due by July 1st. So as a reminder, lead agencies, that's states, territories, and tribes, they complete their CCDF state plans every 3 years, and those serve as our applications for federal funds for the state. So our current state plan goes through September 30th, 2024, and our next state plan will take over effective October 1st. We have to submit that state plan, like I mentioned, by June 30th or July 1st, going into effect later this fall. And those plans, even though they sound aspirational, unfortunately aren't. They're really just reflections of how we're utilizing federal funds and meeting federal requirements with our policies that are in place effective October 1st. So on the DELC end, we've really been working a lot across our staff and across our agency, as well as in collaboration with other agencies. And we've also been conducting engagement efforts alongside the DELC strategic plan, essentially with the thought that we didn't want to take up more of people's time and thoughts than they were already sharing. So we kind of tried to combine them together as sort of, how are our childcare and early childhood systems working right now? And then how should we make them better in the future? So kind of pairing together that state plan for the current picture and then the strategic plan for our goals going forward. So we've been doing that already. We've been working on drafting those sections. And then we will be hosting information sessions for the public in mid-May. We're hoping to host 2, and those will be recorded and available on YouTube to stream. And then we'll also be having a public hearing on the CCDF state plan draft in early June. So we should have the actual draft plan available for public comment effective May 1st on our website, and we'll go ahead and make sure that that's all socialized and sent out there. But I just wanted to kind of give a heads up that that was coming so that way you were aware. I think we can go to the next slide unless there are any questions. Okay, so the big reason I'm here to talk to you today, and I will actually be back in April for your next council meeting to go over this in a lot more detail. But this is kind of going to be more of a high level overview just at this point. So it's something that you're thinking about going forward. So this past summer, the Federal Office of Child Care released a notice of proposed rulemaking for the Child Care Development Block Grant Act. And like I mentioned, this is the first time that this rule has been touched in 10 years. It was reauthorized in 2014, and then they made some technical changes in 2016. But other than that, there hasn't been any changes to the rule. And that funds so much of what we do for early childhood, especially for childcare subsidies, because 70% of CCDF has to be spent on direct services to families. So the final rule was made available for public comment, and then it was formalized just at the very end of February, early March, with an effective date of April 30th, based on the results from that public comment. And the final rule has been revised and clarified with a lot of details that formerly didn't exist. There were some areas that were unclear for lead agencies, some things that had been encouraged previously that now are required. And so we're going through on the DELC end for Oregon, going through the process of conducting our analysis around what potential changes we might need to be implemented with the release of the final rule. There are a lot of them. The actual final rule itself and the commentary that was provided with it was 174 pages of documentation and responses to public comments and the reasons why ACF chose to do or not do certain things. And so we went through meticulously through that, really trying to look at how our programs stand up to what these new requirements are. So we're not quite done with that. We're having to do some analysis around, cost and budget and all those different, elements to kind of know what it would take to come into full compliance. But we should have more information at the April council meeting. As far as timelines, lead agencies technically have until June 30th to implement these changes, which is a very, very tight timeline, particularly as some of these changes do require changes to the one eligibility system. And change requests and work items within that system are several years out already. And so we know that that June 30th deadline may not apply for all of the requirements, but we are kind of doing our best to see which ones we can meet by that timeframe. Otherwise, the federal government has said that lead agencies can request a 2-year waiver to implement various elements of the final rule. And so again, we're kind of going through and seeing which elements we need to apply for that waiver for. Our federal partners, unfortunately, haven't given a lot of guidance around kind of what that waiver process is at this time. They did say that we would be able to start requesting waivers in May. So we aren't able to request it yet, but that beginning May 1st, we should be able to make that request of our federal partners. So that final implementation date for all of the required changes will be April 30th, 2026. And then, like I mentioned, there will be more information to follow at the April ELC meeting once we have more of a thorough analysis and kind of a step-by-step of what to expect. And Gabby, I think we can go ahead and go to the next slide. This here is just kind of an overview. Like I mentioned, at the next council meeting, I'll go through in a lot more detail about what specifically each requirement outlines. But the final rule has been revised and it has 3 primary goals. So the first one is around childcare affordability for working families. So it caps childcare co-payments at no more than 7% of a family's income. In Oregon, we already have this in place. And so this is going to be more of an easy one that we're already in compliance with. But it also encourages states to waive co-payments for families at or below 150% of the federal poverty level. That's different than presently, which is 100% of the federal poverty level in the past iteration of the rule. And then it also improves on financial stability for childcare providers and incentivizes their participation in CCDF by essentially ensuring that they're paid on time and then also paid based on program enrollment instead of attendance. This was something that was highly encouraged in the past, but now is a federal requirement. And then lastly, the final rule makes it easier for families to access CCDF, really trying to focus on online application portals and coordinated enrollment with other programs, as well as presumptive eligibility as an option for lead agencies to consider for children who already receive subsidy for their siblings. And there are a lot more details within the final rule, like I mentioned, but these are just kind of the overview that the White House put out.
So Jordan, quick question. Aren't we already in compliance with the second bullet as well?
It's a little bit tricky, Sue, because we had believed that we were fully in compliance, but the rule does give a lot more clarification. One of the things that it specifies actually is that providers have to be paid on or before services are provided or on or before the first of the month. And that's one area where our current systems or the systems that we've been utilizing for those provider payments haven't entirely adhered to that specific date. And so we're doing some analysis and investigation with our teams on what that would take to get to that point. If that's something we can do within our current systems, or if that's something that we'll have to roll into our new provider management platform, and then really trying to partner with the federal partners on kind of what the timeline will be for that.
Got it.
Yeah. And there's also some more information around enrollment instead of attendance too, that I can go into next month in more detail, kind of explaining what we still have to meet on compliance in that area. But it does sound like the first and the last one are going to be probably the ones that we already are in compliance with. That second bullet is going to be where most of the bulk of the changes are going to be.
Okay, well, nice to know that 2 of them may not be hard.
Yeah, really. There are other requirements as well, but there were a lot and I didn't want to take up too much of your time. Just really wanted to make sure that this was something that you were aware of, as it has gotten a lot of media coverage federally, and it is a really big deal that this has been changed for the first time in 10 years. I think, Gabby, can you go to the next slide? Thank you. And I think you should have these slides already, but here are just some resources that I put together, just that you can take your time and read through any information that you would like to. Our current Child Care Development Fund state plan, as well as past state plans, and that first link, the template for this next state plan 3-year cycle. It's going to be that second one called the preprint. The final rule, that third one there, is exactly what we've been talking about, that 174-page document that talks about all the changes that went into effect for the first time in 10 years. And then that final fact sheet from the White House that kind of goes over on a more of a higher level. And then my email for any questions.
Wow. I'm sure glad I don't have your job, Jordan. I just want to say that. Are there questions from council members, knowing we're going to hear more about this at our next meeting? Okay, thank you, Jordan. We'll look forward to seeing you in April.
Wonderful. Thank you for having me. Take care.
Bye-bye. We'll now move into the administrative rulemaking, as you know from our agenda. Chris, do you want to make any opening comments, or are we going to just jump right to Abby?
I'll make an opening comment. So good afternoon, everyone. Chris O'Grady, she, her, the Legal Affairs Manager here at the Department of Early Learning and Care. Today, we have a sneak preview of some of the work that's going to be done for rule changes for registered and certified families. And then we have 2 rulemaking actions that will ask the Early Learning Council to vote on for the Micro Center pilot program and for the Baby Promise program. And then we will have presentation on rule repeals that we will need. And I will turn it over to Abby from the Child Care Licensing Division to start with the rule preview.
Hi, hello. Thank you, Chris, for that introduction. And good afternoon, Chair Miller and fellow council members. My name is Abby Strom, and I'm a policy analyst with the Child Care Licensing Division. And I am here to speak to you about 2 topics. The first is to give a brief overview of the engagement work that we've completed thus far in regards to family child care rule revision. And secondly, we will review the Micro Center pilot program and specifically the administrative rules that will support the administration of that program that we are proposing for adoption today. We'll review the public feedback that we received regarding the Micro Center pilot program rules, and then also the response that we made based on that feedback. Okay. Next slide. Oh, we're already there. Good. Oop, go back. Thank you. Sorry about that. So in terms of family child care engagement on rule revision, when we refer to family child care, that includes both registered family and certified family child care homes. DELC is applying the same guiding principles when revising these rules as we have with other childcare facilities, such as our school age programs, and then also the certified center rule revision, which occurred last year. One of the guiding principles is really centered around hearing feedback from those who work directly in the field, identifying those barriers, and then when we can, removing or reducing those barriers. We know that the Early Learning Council places public engagement, places public engagement in high regard. And in order to present a high level of feedback from this body of work, we've implemented several strategies to engage with child care providers and the broader community. Strategies include listening sessions with providers in open-ended online feedback form, as well as a community work group on rule revision. And then finally, we will hold a rulemaking advisory committee. We are convening a work group on the behalf of the Early Learning Council, and this will ensure public access as well as the ability to reimburse members of that work group for their time. Okay, next slide. This is a general timeline of engagement milestones, and I do want to mention that engagement on this work really began prior to the pandemic, and we've really just recently picked back up the engagement for family child care rule revision. And that began in January when we hosted listening sessions with child care providers. Beginning in February, we opened up an online feedback form, and that will be open until the end of April. Common themes identified as barriers to providing care through both listening sessions and the online feedback form will be taken to a community work group, which will support the development of rule language in those identified areas. At the June Early Learning Council meeting, we'll present a summary of the feedback we received thus far and preview proposed rule changes based on that community feedback. And then the RAC will be held in late summer and early fall with a presentation to the council in September in regards to the content and rule changes we made based on that feedback. And in addition to that, we will come back to the council in December with a proposed vote for the rules. Though we are planning to propose rules for adoption in December of 2024, those rules will not become effective until July of 2025, which would allow for agency staff training, the development of resources and technical assistance documents for providers, those that will be implementing the new rules, and then any IT updates that are needed for implementation. Just one additional point of engagement, we have scheduled monthly meetings with AFSCME leadership to go over proposed rule changes, present concepts, and then also gather their feedback. Okay. Are there any questions on family child care engagement thus far?
No, I think it's a very impressive engagement timeline and structure, Abby. And council, I want to make sure you heard Abby say that they've actually started this rule revision. I think you said pre-COVID.
Correct.
Okay, so this is not something they've just been doing in this timeline. I mean, that's back in 2019. So this has been a very in-depth look and alignment of our different rules. So this is really important work and very intense. So Abby, thank you very much for overseeing this.
Thank you, Sue.
I think we all will appreciate the monthly engagement with AFSCME so that we get their input all through this process and not in December.
Okay, next slide, if there are no other questions. So I'm going to jump into the Micro Center pilot program by giving a brief overview. And so in 2023, or during the 2023 legislative session, Senate Bill 1040 was enacted and required DELC to establish and administer a pilot program to support the development of a sustainable model for micro centers to provide affordable, high quality early learning opportunities to communities across the state. Oh, next slide, please. Oop, there we go. The statute defined a micro center as a childcare program that serves a minimum of 3 and a maximum of 30 children and operates for more than 4 hours a day. The statute also identified some of the eligibility criteria and priority criteria when selecting program participants. The pilot will include 3 childcare programs who will work directly with the pilot administrator, which is Carol Peterson, who presented the pilot information about the pilot in detail at the January meeting. And they will identify unique barriers to these small capacity programs that they experience specifically in licensing rules and regulations. Pilot participants will apply for and receive exceptions or waivers to these identified rules, and then data collected during the pilot will be used to develop a legislative report that will detail recommendations to support the viability of small capacity programs. The statute specifically requires DELC to develop eligibility criteria and an application and selection process through administrative rules. These rules will appear very similar to what is in the bill itself, and they are what we are proposing for adoption today. Okay, next slide. This is just a really high-level timeline of the pilot activities. We held the RAC in January, which we will go over the feedback in the next couple of slides. We're presenting the rules for adoption today. During April and May, we will open the application window for programs to apply, with applicants selected hopefully by the end of May and possibly even earlier than that. We will be conducting the pilot and collecting data from June of 2024 through June of 2025. And then through the summer of 2025, we'll review the data and consider any recommendations we have, and then finally submit the report to the legislature in September of 2025. Okay, next slide. The rules themselves they're very short. It's only about a page and a half. And it covers the purpose, the definitions, the program eligibility criteria, application process, program selection criteria and participation, as well as the program guidelines. I've bolded application process and program selection criteria because those are the two areas where we received the most feedback during our community engagement. Okay, next slide. So in terms of the selection criteria, the bill states that DELC must select 3 programs from the following geographic areas, and that any child care program from across the state can apply to participate. We will review and consider the applicant eligibilities on a first come, first served basis. That is also in the bill as a requirement. And then the bill also states that DELC can prioritize applications in areas that have the greatest need for childcare and are willing to participate in CACFP or enroll in CACFP, which is the federally funded food program. And we can also take into consideration the socioeconomic status of the families that are served in that area. The following slides will detail the feedback that we received during the RAC and then our response. Okay, so in terms of the application, I just wanted to give a brief overview of the RAC participation. We had over 60 applicants for the Micro Center Pilot Program RAC, which was held in January 30th. 15 applicants were selected to participate, and the RAC had representation from certified centers, as well as family child care providers, micro center advocates, and also the Child Care Provider Union. Participants came from across the state, including Wasco and Malheur counties, as well as the Southern Coast. So in terms of the application process, we received feedback that they wanted more consideration for the equity impacts of the application submission via mail or online, as the applications will be reviewed on a first come, first served basis. The rule states that we will accept applications either via an online application or mail in a paper application. So that inherently gave an advantage to those who filled out an online application. What we did in response was amended the rule to include a 2-week or 14-day window where applications will not be reviewed to allow for paper applications to come in. Each application will still receive a number based on when it was received and the date the application is received, as well as what priority criteria the program met will be considered when selecting pilot participants. In terms of the applicant selection, the statute states that DELC must select 1 program from the Willamette Valley, the Coast, and Eastern Oregon. The feedback we received is that RAC participants really wanted to ensure that it is known that all childcare programs across the state can apply, even if they didn't feel like they fell into one of those regions. So we will be ensuring that on the application and program materials that we state that any childcare program from across the state can apply. In addition, the RAC participants wanted to know how those geographic regions will be defined. And we are defining those regions generally by placing counties into those specific areas. There are some nuances to that, such as Douglas County stretches from the coast to the I-5 corridor. So depending on where the application or where the program is located will kind of determine whether they fell into that coastal region or the Willamette Valley. Next slide, please. For priority criteria, The RAC wanted us to align the rule language with the statute in terms of enrollment in CACIP, again, is the federally funded food program. So we did amend that rule to include the phrase "or willing to enroll in CACFP." Originally, it did say enrolled in, so we modified it to say enrolled or willing to enroll in CACFP. Since we are looking at the areas of highest need, and that they were wondering how we were going to determine that, DELC consulted with the research and evaluation team to determine and define which areas of the state have the greatest need for care. We will use the Child Care Desert Report as well as census data, current child care license slots, and then the availability of infant and toddler care in the area to make this determination. And then this information will be included in the pilot program materials. Finally, BRAC participants were really seeking additional opportunities to give their perspectives and experiences about operating a small program. Since the pilot is really narrowly focused on selecting 3 programs, we really wanted to give the opportunity to folks that apply to provide us with additional information. So we're going to extend invites to all pilot applicants to respond to surveys about their experiences in operating a small capacity program. This will be an opt-in option on the application itself. And then the survey results and information we gather through that will be used to supplement any findings during the pilot and will also be included in the legislative report. Okay, next slide. So just some next steps for us are we are working to finalize the application and participant materials. We are hoping to have the application available by the 2nd week of April, and then making participant selection and notification by the end of May. And again, the pilot will technically begin the beginning of June and then end of June of next year. I think that's it for me. Are there questions?
Right. Oh, wow. Thank you, Abby, for a great overview of this program. Council comments. Yes, Liz.
So my question, Abby, you had talked about how I think the idea is that these are existing centers, they're going to apply for exemptions. Is the thought process, when I hear that, what that sounds to me like is ideally those people or those programs that are being selected are certified centers that are looking for exemption. Have you guys given much thought to, like, if there's family and center-based mixed into that? I'm not sure that the feedback is going to be consistent about if there's an issue with the center rules itself that's a barrier. You see what I'm saying?
I'm going to attempt to answer your question and let me know if it gets to it. So any childcare program from across the state that is licensed can apply. So it can be a certified center, certified family, or registered family. And they can speak to barriers to existing licensing rules, which could be for certified center. It could also be some of the questions on the application we ask are, or considering asking are if you're a family childcare provider, have you tried to expand your business? And what barriers have you experienced in expanding your business? Because that is also really valuable information and will speak to some of the barriers that exist for small capacity in-home providers that may be looking to expand. Does that?
It does. One small follow-up I had as you were speaking, for applying for those exemptions, how will the agency determine whether it's going to grant those exemptions? Like, there's a whole, sitting on some of those racks before I joined the council, there's a whole host of those things that I would assume are kind of non-negotiable for the agency. So have you given thought to how you're going to navigate which of those exemptions are on the table for this and which of those are really sort of non-negotiable because there's a health and safety concern attached to them?
And that is a great question. And I'm actually going to hand that off to Carol, who is the program administrator.
Hi, that is a really good question. And so what we are doing is we've formulated an internal work group. Our internal work group will be looking at all of the exceptions or waivers that come in. And we have a standard process that we are reviewing each and every exception. When there may be those exceptions that are outside of a typical exception, upper leadership is going to go ahead and help provide us guidance on whether or not we can go ahead and look at potentially approving those, and then help us go ahead and build in some requirements if we do approve. We're not, we cannot approve exceptions to anything that's in statute, nor anything that may be a requirement from another governmental agency. Likewise, we would never approve an exception for anything that could jeopardize the health and safety of children's well-being. So those are kind of our frameworks, but we are trying to be as flexible as possible when someone does present a waiver with certain barriers in mind.
Are there other questions? Thanks for that question, Liz. Obviously, based on your own experience, which is very valuable. Other questions of either Abby or Carol? Yeah, I think my only comment is it's too bad there are only 3, but it's a big state and 3 is better than 0, 1, or 2. So I guess we'll be thankful we've got that.
Hey, Sue, I think Marie is trying to ask a question and she's having trouble. Do you want to, I don't know, interpretive dance your question or?
Sorry, can you hear me?
Now we can.
Oh, okay, great, perfect. I was just wondering, could you comment on the response you got? It sounded like you got a lot of people requesting to be on the RAC, but could only fill 15 slots. So I wondered, what I heard also was that you're looking for feedback only from participants that apply for the program. And I'm wondering, based on the limited number of slots, which may or may not encourage people to actually apply for this program, but what sounds from my perspective as significant interest in having participation, if you've thought about how to garner feedback from those folks that may not be swimming in that same lane because maybe they're not seeing the opportunity to really capitalize this go around, but probably have some significant feedback or experience that could be beneficial as we build out this program.
Thank you for that question. Carol, is this something that has come your way? I know that we've discussed multiple avenues for collecting feedback on this, but I don't know if Marie's specific question has been addressed and whether we need to come back to that.
I think we will have to come back to that. That is a very good question and a good suggestion. So we'll definitely come back to that. Thank you.
And I just wanted to note that this program via statute is a pilot program, so it is set to expire if the legislature does not continue to take action on this. And as we go throughout the pilot program, there will be a report written to the legislature on the administration of the program and lessons learned. So that will be an opportunity to incorporate that feedback.
Okay. Yeah, I think, sorry, I think Chris, my, I guess, question or hope is around garnering enough feedback to inform the report to the legislature so that they may, we may support them renewing it and making sure that that feedback is really robust and diverse. as where what the program, it sounds great and it's very exciting, but it is 3 programs, so it's a very limited number. And I would just be concerned that that's not may not be enticing for a lot of programs to go after because there's only 3 across the whole state.
Yep. And that is what Carol will come back to on how the team is working to get that feedback and incorporate it. And I just wanted to say what the mechanism was in moving forward, but we have to follow up with that information at a later date, Marie.
Yeah, and you know, one of the other challenges we have, as you look at the timeline, with the report doing in September of 2025, that's after the next legislative session ends, right? And Peter, I don't know, having been in the legislature, if you have any suggestions of, you know, how do we get in the 25 budget to continue the pilots?
Yeah, you're going to have some outcomes, early outcomes that you can bring to the legislature, whatever they might be. There's going to have to be some clarity that says this is why it's going in the right direction and we need to continue it. And that could happen as late as, you know, April or May of 2025, but that's about as late as it could go.
Okay, I think we should ask staff to really build that into some of the data collection and reporting and keeping the council current on what are the findings, what are the outcomes you're seeing, so that we can see if we can actually advocate for continued funding in the 25 session. Otherwise, we lose another year and a half. So if you could build that into your planning, that would be great. Thanks. Any other questions before I ask Ruby to put a motion before us? If not, Ruby, would you make a motion?
Yes. I move to adopt the proposed rule language amendments dated March 27th, 2024 that adopt Oregon Administrative Rules 414, 330, 0100, 414, 330, 0200, 414, 330, 0300, 414, 330, 0400, 414, 330, 0500, and 414, 330, 0600.
Thanks, Ruby. Is there a second for that?
Second.
Thanks, Barry. Any further discussion of this program in the motion? Hearing none, please, those in favor, raise your hand, say yes, whatever.
Aye.
Right? Any opposed? And any abstentions? All right, passes unanimously. Thank you, Abby and Carol. We're excited to see this rolling forward. And we'll look forward to seeing you again. All right, let's go to Baby Promise. All right, I saw Mady earlier.
Hi, everyone.
Welcome back, Mady. Good to see you.
Good to see all the council members and you, Chair Miller. My name is Mady Rosengarten, and I am the Baby Promise Program Manager. I was here about a month ago to talk about the rule set that you'll be voting on and to give you some information about Baby Promise. And today I brought back what we learned from our committee and what we did about it. So you can go to the next slide, please. So there were basically 2 kind of buckets of feedback that came from the rule setting committee. And the first was general feedback that I wanted to just bring back to you. It's outside of the scope of the rule set, but I wanted to keep you informed. I'm sure that these are items that you have heard about before. The first was wages for early educators is a concern. The struggle for families to navigate systems such as the One System and ERDC. The cost of insurance continues to be a concern, and you've heard about that, especially for family, home, and small providers. families transitioning from baby promise to preschool, especially preschool promise, the lack of alignment in the program hours is hard for working families to adjust to. The cost of care grows higher than the supplement that providers are getting, and costs continue to increase. So there's concern about that. And then families who live outside of baby promise regions, of course, can't access slots. The families need to reside in the zip codes of our regions. So these were some of the themes that floated to the top that were kind of outside the scope of the rule set, but I wanted to share with you. And then you can go to the next slide, Gabby. Thank you so much. And then the other set of themes that I felt were concepts that we could address and where we did make some adjustments to the guidebook and the manual. 3 main points here. The first is technical assistance. Different kinds of providers need different kinds of technical assistance from their CCR&R partners. Some of it has to do with being operationally ready to be a baby promise program. Some need heavier amounts of assistance before they subcontract, some during their subcontractual period. And it's not always easy for the CCR&R TA folks to meet those needs. And those needs tend to be ongoing, and they don't always line up with other baby promise providers' needs or planned TA or trainings that come from CCR&Rs. And so there was a sort of a real request to somehow can we increase the differentiation in problem identification that providers experience, find solutions, and then support providers in that area of technical assistance. A second one that came back had to do with language accessibility and access to documents. Providers would like more documents in different languages, and they would like more forms, more templates, more baby promise branded things to use. And that is definitely something we are able to do. And it was great to get this feedback, because that's one that that DELC is got up and running really well. And then the third piece was about cultural responsiveness. And this sort of is about a request to, in our documents, articulate, acknowledge the realities of different kinds of programs and describe some processes for programs so that they can remain culturally responsive, which means that they can honor their cultural preferences, but they can also meet the requirements of the program. So this came up around meals. There was a lot of examples around mealtime, around children's absences, and then again around technical support. So those were the 3 areas where we went back into our 2 documents and were able to look at the way that we framed some of our writing and our language to address these issues a little bit more clearly and with a little more clarity, I guess. And then I only have one more slide, which you can go to, Gabby, which is they said so many wonderful things about baby promise. And I wanted to just share with you all of the positive comments that were made. I put together this little word cloud, and it was really cool to see that families came out right in the middle. It was the word that was used the most often in the comments around how well baby promise is working and how much the programs are really benefiting and the families are really benefiting from the baby promise program. So that is my little report, and I'll be happy to take any questions.
Thank you, Mady. it may be a little report, but I know hours and hours have gone into preparing it. So thank you. And a great advisory committee that you had. The RAC obviously performed exactly what we need RACs to do and giving really tangible feedback. So, a question I would throw out on the first, I think it was your first slide, second slide, I guess, on the general feedback that you received. Some of those, you're right, we've heard all of them before. Some of them we can't control, like wages. We wish we could. But when I look at something like the transition from baby promise to preschool, it seems to me that that is something that DELC should be able to really take on and say, it may be out of the purview of baby promise, but we're going to try to make sure those transitions happen well. So, I don't know if there are any other ones on that general feedback list that DELC actually could pretty much impact or take the lead on, but I think it'd be worth looking at. And I don't know who establishes the cost of insurance, but I know we hear that as a barrier a lot, all the time. Katie.
Thanks, Sue. I'd also like to add a comment on the same slide you were just referring to. Some of the other things that I hear about from providers as well is that, I think it was the last bullet, is just the implementation and the learning curve of qualifying. And you do one thing wrong, and then it takes a year to get reassessed, which is just tough for everybody. And so that speed, and instead of, I guess the best way to do it is the approaches of assistance, rather than the end result being punitive somehow, to integrate that so it's quick, it's easily accessible, and with in mind that folks are trying to do the right thing and they just need some help.
Exactly, beautifully said. And those were the kinds of things that we worked hard to be more articulate about in our documents.
Great, thanks, Katie. Great comment and observation. Other comments or questions from council members? And this is a very exciting date as far as I'm concerned. I think I said it last time we saw Mady a month ago that we just hadn't talked about family or baby promise in a long, long time. So I want to congratulate staff on actually getting us to the point where it's going to be on the books, which is.
Hi, Sue, this is Marie. Just a really quick question for Mady. It sounded like your involvement with your RAC was high. I just wondered if you could really quickly tell us how your engagement process was with your RAC.
Sure, that's a really good question. I sweated a lot over it. It was a wonderful experience. We did 3 meetings. The meetings were each an hour and a half long, and I spread them out so that we could, on the DELC side, could work in between the meetings to get all the materials translated, because we also had Spanish speaking participants. We did have participants from each of the 3 baby promise regions. So we had providers, we had CCNR folks, hub folks, and then we had community-based organization people as well. So it was a wonderful mix, and I organized it such that there were questions for each sections of the documents that we were reviewing, and some were very, very pointed, and some were things like, what is your most urgent concern about this particular section? And some were, what made you feel good? So really tried to ask some open-ended and some closed-ended, used Jamboards, collected all that information, and then really fed it back to the committee as quickly and as articulately as possible so that they could use their time together as best we could. It was exciting. They were great. We had
And I
tons
want
of comments.
And I want to give Mayday a huge kudos to the RAC engagement process. As an agency, we've really been trying to build more formalized structure into what public engagement and the rulemaking advisory committees look like. And because of the content of our rules, many of our rulemaking advisory committees are only 60 to 90 minutes, but because of the amount of information that we needed to cover in the guidebook and the manual, Mayday structured it in those 3 meetings to make it more accessible for providers and for later in the day, and for CCNR administrators to participate. So it was a huge lift, but the level of community engagement was very high.
Awesome. Thanks, Chris. Okay, seeing no other questions or comments, Ruby, will you put a motion on the table?
I can get off mute. I will. Yes. Thank you. I move to adopt the proposed rule language amendments dated March 27, 2024 that adopt Oregon Administrative Rules 414, 480-0000, 414, 480, 0010, 414, 480, 0015, 414, and 414, 480, 0035.
All right, is there a second for that?
I'll second it.
Thanks, Katie. Any discussion? Hearing none, will you please, all in favor, raise your hands? Thank you. Any opposed? Raise your hand, and any abstentions? All
And
right.
so just acknowledging that Marie said yes in the chat. I know she's off camera.
Okay. Thank you. And thanks, Marie. All right, it passes unanimously. Maybe thank you. It's been fun getting to know you. I assume we'll see you again.
I hope that we see each other again soon. Thank you all very much.
Thanks, Maybe. Nice job. So we've done the 2 action items, and now we have a briefing, sort of once again telling us what's ahead. And I'm not sure, actually, Chris, who's taking this?
I'm taking the lead on this, Charlie. Thank you.
All right.
So I don't have something fun for the Early Learning Council to vote on this month, but I will be bringing this for vote next month in April. In the fall of 2023, we did a rules audit for our entire agency. And as a result of that rules audit, we need to bring forward some rule repeals to the Early Learning Council. And the 3 sections that we are moving forward with rule repeals are on the Child Care Contribution Tax Credit Program and the Dependent Care Planning and Development Program rules and the Migrant and Seasonal Child Care Program rules. Next slide. So as a matter of best practice, an agency will conduct a rules audit every 5 years. This is really meant so that our rules are a tool of transparency for the public, so they know how we are administering all of our rules. It's a place where they can reference how we are interacting with the public to hold us accountable, but how we also hold the members of the public accountable for our rule sets, depending on the program and the programmatic area. And there are updates in how we use everyday language in our rules. So it's best practice that an agency reviews their rule set every 5 years for these more technical changes. Our big reason for why we did a rules audit in fall of 2023 is because we just had an agency change. So we needed to go through all of our rule sets and make sure that the agency name change was reflected in all of our rules and that the division name change was also reflected. So from going from the Early Learning Division to the Department of Early Learning and Care, and our Office of Child Care was renamed to the Child Care Licensing Division. So we needed to go through all of our rules to make those. Many of those changes were minor revisions, but we did have some major revisions that we need to go through. Something else that we looked at in our rules audit is to see if we needed to make any statutory updates. Every legislative session, we have statutes that are amended and adopted, and there are times that new statutes have been impacted our work were passed in the last 10 years, especially as our work has moved from different departments like the employment department and from the Department of Education, and even moving the employment related daycare program over from the Oregon Department of Human Services. So we also need to make sure that our statutory references are correct. So if a member of the public is looking at our rules, they know which statute to reference, why we have that rule set, and kind of what the parameters of our rules for that program are. And then the last reason why we conduct a rules audit is that we need to make sure that if we are citing to other agencies' rules and their rule sets, that they're still accurate. Because just as we've gone through a lot of changes in our agency and our programmatic work, other agencies do as well. So we want to make sure that we're pointing the members of the public to the right agency rule sets for other agencies. So as a result of this rules audit, there were a few programs that we actually don't administer anymore, that we actually need to do a rules repeal. And this was just an oversight that we've had throughout the years as we were moving fast through other buckets of work. So one of the first ones, next slide, is the Dependent Care Planning and Development Program rules. And the background on this rule set is that this program rule set really set out the design and administration of childcare subsidies before the launch of the employment-related daycare program, and how we were using federal funding from the Child Care and Development Fund to fund subsidies. And prior to the rule set outlining the role of Child Care Resource and Referral Network. So if you look at this rule set, it's really a combination of subsidies and how the Child Care Resource and Referral Network is supposed to function. And it outlined the administration of the subsidy program when it was at the Oregon Employment Department, and not how the subsidy program functions now within ERDC. The need for these program rules expired in 2017, when any remaining functions of this rule set were covered in the employment-related daycare program rule set and the Child Care Resource and Referral Entity rule set. So there's no purpose that we need them now. So we will bring them to repeal and for a vote on our next Early Learning Council meeting in April. So we will be repealing this entire division and bringing this to vote. Any questions on this program rule set and the need for repeal? Okay, next slide, Gabby. The next one is the Migrant and Seasonal Farm Worker Childcare Program rules. This program was funded through the Child Care Development Block Grant, or you can see it referenced as a CCDBG. Often in parlance, when agency staff are talking about it, they'll reference it as CCDBG. And the Child Care Development Fund, which is what Jordan was talking about earlier, and how the federal program actually enacts new final rules every few years. This program used to be funded through those dollars, and it served as a seasonal or as needed drop-in use childcare in which families could use their childcare subsidy. But the Federal Office of Child Care changed CCDF rules in 2014 that went into effect for the agency because we asked for a waiver until 2017. And we were no longer able to carry out the administration of this program how it was, because when the reauthorization of CCDBG, it mandated that families receiving childcare had to be eligible for subsidy benefits for a full 12 months. And this just didn't fit the model that we had for administration, and didn't allow the department to administer the program in a way that met the needs of families that were served by this program. So we're asking for a repeal of this entire division. One thing that we did want to note here is that the funding for serving families in this area is a little bit smaller, but there is still in the state, the Migrant and Seasonal Head Start program, which is a federal to local funding model. And the federal government funds migrant and seasonal Head Start programs directly. And so the U.S. Department of Health and Human Services Administration for Children and Families opens a request for proposal process, and local agencies can apply for that funding directly. Right now, Oregon only has one of those providers, the Oregon Child Development Coalition, that offers those services in communities with large populations of families that are eligible. And in 2022 and 2023, in that program year, OCDC served 2,384 children through that program. So although this program isn't functioning through CCDF funding, we still have that one provider that provides migrant and seasonal Head Start. Any questions on this repeal? Okay, next slide, Gabby. And the last section that we'll be asking for repeal on is the Child Care Contribution Tax Credit Program. And this program was started in 2004, and it was intended to encourage taxpayers to make contributions to the Child Care Licensing Division by providing a financial return on qualified contributions and by soliciting other contributions. Over the years, the department had received around $6.6 million of contributions for this program, but in 2018, new guidance was released by the IRS that limited a taxpayer's ability to claim a federal charitable deduction for amounts donated when the taxpayer receives a state credit that offset some or all of the amount that was donated. And the agency really saw a heavy decrease in contributions from 2016 onward. And the Oregon legislature, because they saw this change and because of the federal guidance that was released from IRS, decided not to renew this tax credit contribution program. And the Oregon legislature let this tax credit expire in 2021, and the fund was spent down. So these are no longer rules that are used in any administration of the program. So we will be asking for a repeal of this entire division as well. Any questions on this one?
I just think it's disappointing. This final one is really, it's disappointing. The money gets smaller and smaller, and even when you want to make a private contribution, they made it harder to do. It doesn't make any sense to me.
Yeah, and the contribution, not only did it make it harder to do, but it went from 75 cents on the dollar to 50 cents on the dollar. So even the credit was smaller. It was an unfortunate move on the federal IRS.
Right. Once again, children aren't the priority in many cases. Okay, any questions of Chris on any one of these repeals that will be coming to us next month for action? And I think next month, what I'm going to ask Chris to do is just put these slides in our packet, assume and know that we will have reviewed them again, and then we're just going to vote on them. I mean, ask for questions and comments, but then we're just going to vote. So there'll be opportunities if you've got concerns or questions, but we'll pretty much try to run through them. Okay.
Chair Miller.
Thanks, Chris. We appreciate you a lot. Okay, and I should have mentioned at the beginning of this afternoon that there was no public comment requested, and that's why I just skipped right over that item, but wanted to put that on the record. So council members, we're done 5 minutes early. So comments, questions about today's meeting. Staff and I are putting together the agenda for April. I appreciate the comments and suggestions several of you have sent in. about what topics you'd like to see on future council agendas. We are putting all of those together and with some of our best thinking. We know that in May, we're going to focus on housing. We've coordinated that around Director Bell's schedule. We were going to do it in April, but she can't join us. So we'll do housing in May, and then we'll focus on the hub updates in June. So looking forward to both of those. And in April, we're looking at some childcare pieces. We heard Rep. Reynolds today, and we know the governor in the past has talked about a prenatal to age 1 or 2 agenda. So where do we fit there, and how do we support those agendas and fit them into Raise Up Oregon? Talked about social emotional support, trying to get ready for the suspension expulsion prevention in 26, and an update on where the pyramid model is. So lots of topics that council members are interested in and we play a role in. So we will be putting that together. Any other comments, wrap-ups? Well, I want to thank Peter and Peg again for co-chairing the Home Visiting System Committee. I think we really saw in this morning some of the benefits and real outcomes of the work that committee is doing, obviously in tandem with Beth at PSU. But there's a lot to put together from this morning and what the state agencies have shared. So I'm very excited about where this initiative's going, but know that Peter and Peg are spending a lot of time moving this forward. So thank you.
So are you, Sue. So are you. So just to acknowledge, you are too.
Thanks, and Robin and Ruby, and there are a lot of us who are quite invested in this. Okay, well, have a great rest of your afternoon, and we'll see.